Are procrastination, distractions, and burnout hindering your progress in personal and professional spheres? In this book, ADHD and Focus, Eric Holt presents a comprehensive guide filled with proven techniques that will transform your life.
Hello, this is Eric Holt, and you are listening to ADHD and Focus, techniques for men and women with adult ADHD to boost your self-discipline, productivity, time management, and emotional control to overcome procrastination, distractions, and burnout. Provided to you by United Audiobooks. I hope you enjoy my audiobook. Now, let us begin.
Introduction. Focusing on work is difficult. You feel easily distracted and absent-minded. You have trouble managing your time, and you can't focus for a sufficient amount of time. If any of the aforementioned rings a bell, you are not alone. According to studies, 2.5% of adults and 8.4% of children are thought to have ADHD, Attention Deficit Hyperactivity Disorder. It is a prevalent condition that can affect both adults and children. Simple signs include fidgeting or squirming, excessive talking, difficulty relaxing or playing quietly, and difficulty sitting still. This can also be to blame for temper tantrums or outbursts of anger caused by failing to control strong emotions. It's crucial to remember that impulsivity, hyperactivity, and inattention symptoms do not necessarily indicate ADHD. Making your payments on time, managing your family, career, and social obligations, and keeping up with everything else can be hard if you have ADHD, also called ADD. Adults with ADHD may experience difficulties in all facets of life, including relationships at home, work, and health. Extreme procrastination, difficulty meeting deadlines, and impulsive behavior could all be caused by your symptoms. Additionally, you can think your loved ones don't understand your challenges. Fortunately, there are methods you can learn to control your ADHD symptoms. You can develop routines that improve your ability to operate more efficiently, keep organized, and interact with people. You can also learn to recognize your abilities and play to them. Helping yourself can involve explaining what you're going through to others. However, change won't happen overnight. This self-help approach to ADHD needs tenacity, stamina, and, most importantly, a positive perspective. Utilizing these strategies increases your self-worth and makes you more productive, organized, and responsible. We created this guide to help you understand ADHD from start to finish, because adults are currently the age group obtaining diagnoses at the quickest rate, to the point that some specialists are concerned it might be overdiagnosed. Let's begin. Understanding adult ADHD. Adults are now diagnosed with Attention Deficit Hyperactivity Disorder, ADHD, or Attention Deficit Disorder, ADD, more often, and sometimes very late. What are the effects on people with the disorder? And what assistance can the doctor or pharmacist provide? For people of a certain age, ADHD means hyperactive kids who may be American and taking Ritalin. It, therefore, comes as a shock when peculiar behaviors they had displayed their entire lives are identified as ADHD, a neurodiverse condition. Contrary to popular belief, there are more people in this category. How many, then? According to official statistics, the number of individuals receiving prescriptions for ADHD medication has sharply increased in the U.S. over the past 4 years, increasing treatment for the condition by 80%. The prevalence of ADHD in U.S. adults is also estimated by the Centers for Disease Control and Prevention, or CDC, to be between 3 and 4%, with a 3-to-1 male-to-female ratio. According to the same source, 3 to 6 out of every 100 school-aged children have ADHD, and 1 in 8 will continue to have it as adults. Given that approximately 338 million individuals live in the U.S., roughly 20 million of them or more have ADHD. What is adult ADHD? ADHD is a condition characterized by inattention, hyperactivity, and impulsivity. Adult ADHD is simply ADHD, as you might have assumed, but in adults. While the symptoms are the same in adults and children, the manifestations can vary. Symptoms include forgetfulness, restlessness, trouble focusing, anger and emotional instability, rebellious behaviors, and loud disruptive tendencies are more common in youngsters. Adults may exhibit disorganization, poor time management, low stress tolerance, agitation and anxiety, forgetfulness, loss of attention, a sense of being propelled by a motor, or the inability to sit still. To put that into context, kids with ADHD might daydream a lot, act out during quiet time, interrupt people inappropriately, and have a room that looks like a disaster area. It can be more difficult to spot in adults because the symptoms closely resemble burnout and stress, which practically everyone experiences these days. Adults with ADHD may change jobs or relationships often, struggle to keep track of their schedules regularly, not just during busy times, be overly critical of themselves or have low self-esteem, and have trouble falling asleep or relaxing, i.e., the person who is multitasking while watching Netflix, reading a book, and checking email at the same time. Adult men and women may also experience the symptoms of ADHD in various ways. Men often express hyperactive traits, while women with ADHD show calmer, inattentive traits. They can forget to carry out their plans or feel perpetually overburdened by a long list of tasks they cannot complete. The prevalence of ADHD in men and women. Are men or women more likely to have ADHD? This is a difficult answer. According to the CDC, 12.9% of men and boys and 5.6% of girls and women have ADHD. However, these data may understate the extent of the impact on women and girls. Although it is underdiagnosed in girls for various reasons, ADHD is just as common among them. Diagnosis. Even when their symptom profiles are identical, boys and men are more likely than girls and women to be referred for services, which results in greater diagnostic rates for boys and men. According to a 2019 study, female patients may be more susceptible to having their ADHD diagnosis missed throughout the diagnostic procedure. Women are less likely to be diagnosed with ADHD and be prescribed medication, since they don't often exhibit the disruptive outward symptoms linked with the disorder. We have seen that varying diagnosis rates are often linked to variables like culture and gender prejudices and expectations due to our experience working with people who have ADHD and are living with it. According to research, women and girls are more prone to receive incorrect diagnoses for other mental health diseases, such as bipolar disorder, personality disorders, sadness, and anxiety, due to a lack of knowledge about ADHD in these groups. The diagnosing process for adults might be difficult because it must be done thoroughly. People must consider comorbidities, trauma, medical issues, etc., as they seek a diagnosis later in life. Usually, someone who needs ADHD testing will be referred by a mental or medical health expert. After that, they'll complete a psychiatric evaluation and several cognitive testing procedures to get a diagnosis. The starting age. ADHD symptoms can appear as early as 2 to 3 years old. However, they usually appear before 12. Because of how the symptoms express themselves, boys typically begin earlier than girls. According to a 2021 study on adult-onset ADHD, symptoms that appear later in life may be brought on by childhood problems that weren't treated by a doctor, among other things. Although symptoms might change over time, especially with an early diagnosis and effective treatment, ADHD is a lifelong neurodevelopmental illness, meaning people don't grow out of it. Teenage years bring about hormonal changes that, if left untreated, can cause symptoms to worsen. For instance, variation in estrogen levels might influence the severity and manifestation of ADHD symptoms at several life phases, including puberty, the monthly menstrual cycle, perimenopause, and menopause. We have observed that, particularly in recent years, the diagnostic rate among women between the ages of 30 and 45 has been rising quickly due to pandemic-related changes in structure and environment. Symptoms. Depending on a person's gender, age, and other traits, there are different ADHD symptoms. I don't think there are appreciable variations between men's and women's symptoms. Due to structural and functional differences between the male and female brains, behaviors and presentations of the same ailments differ. ADHD signs in females and young girls. Women are less likely to exhibit external hyperactivity and impulsivity than men. Women who experience internal hyperactivity often overthink, have intrusive thoughts, and engage in negative self-talk. Other internalized signs of inattentiveness, distractibility, and hyperactivity in females and girls with ADHD may include maladaptive daydreaming, anxiety, depression, dozing off during conversations, easily losing focus, auditory processing disorder, forgetfulness, eating disorders, hypersexuality, impatience, body-focused repetitive behaviors like skin picking, hair pulling, leg bouncing, exhaustion, insomnia, crying out with intense emotion, anger, and feelings of guilt, perfectionism, people-pleasing, codependency, body dysmorphia or a negative body image, low self-esteem, overachievement or underachievement, strong emotional reactivity, and overload are further signs of rejection-sensitive dysphoria, or RSD. ADHD signs in boys and men. On the other hand, men and boys with ADHD are more likely to exhibit outward signs of the disorder, such as hyperactivity, e.g., fidgeting, disruptive behavior, always losing things, interrupting others during conversations, aggressive behaviors, and high-risk behaviors, e.g., substance abuse, speeding, unhealthy sexual behavior, excessive spending. RSD can manifest in guys with the same severity as in women. Low self-esteem and insecurities can also affect men, although they typically manifest as the following: anger, indifference, self-centeredness, appearing uncaring of others' feelings, making fun of others or being sarcastic, trying to be right or disproving others' assertions, and defensiveness. Men who experience elevated emotions or emotional dysregulation may exhibit more tantrums and outbursts of anger. Many men are emotionally sensitive, and due to gender bias, they feel ashamed for this because it goes against society's expectations that men should be tough or strong. How ADHD may be affecting your life. The obstacles of living with attention deficit hyperactivity disorder, ADHD, can make life more challenging and confusing. People with ADHD could even doubt whether they can lead a typical life. Fortunately, ADHD is easier to treat and maintain than other conditions once the issue is identified. ADHD might even boost your creativity, which could help you succeed in professions that call for new ideas or ways of thinking. Being an adult with ADHD might make concentrating on work or conversations challenging. Some people could mistakenly assume that someone with ADHD is disorganized, sloppy, or lazy based on their behavior. People with ADHD may find it more difficult to form relationships and perform well at work due to this stigma. Compulsive eating. When you have ADHD, it's common to find it difficult to control your behavior, such as eating. Additionally, ADHD often causes dopamine levels, a hormone in your brain's pleasure area, to drop. You can temporarily increase your dopamine levels and regain that positive feeling by overeating. Anxiety. Anxiety is indicated by persistent worry that prevents you from living the life you want. An anxiety condition coexists with ADHD in adults in about half of cases. Your symptoms of ADHD can occasionally make you feel tense. In that situation, managing your ADHD also lessens your anxiety. Use of illicit drugs. The same thrill-seeking tendencies that cause uncontrolled eating can also contribute to excessive and improper use of drugs and alcohol. Medical professionals say drug or alcohol use disorders and ADHD may be related. Chronic stress. Your ADHD symptoms can be stressful. When you have the disorder, your stress level is probably higher than the average over a longer period. Stress might eventually cause other problems like muscle strain and pain, breathing difficulties, heart problems, difficulty controlling blood sugar, and digestive problems. Sleep issues. ADHD may hamper your sleep. It increases your risk of snoring, sleep apnea, and restless legs syndrome, which causes you to feel the urge to move your legs when lying still. It may also throw off the circadian rhythm, your body's internal clock. That indicates that your sleep is out of phase with the sun's normal rising and setting. As a result, you may find it difficult to wake up and fall asleep at regular times. Employment issues. While every workplace is different, most of them demand that you show there on time, be attentive, focused, and organized, and do the assigned task. These can all be made more difficult by ADHD. As a result, you might not be able to meet your employer's expectations, so keeping a job can be difficult. Challenges with deadlines. You may become forgetful and inattentive due to ADHD. Because of your focus issues, you probably also struggle with time management. Missed deadlines or tasks for work, school, and personal projects are possible effects of all of these symptoms. Uncontrolled spending. Purchasing goods just out of want temporarily elevates your feel-good chemicals. But there might be a cost for that. Your impulsive spending may leave you with a depleted bank account or damaged credit. Financial problems. Missing deadlines and engaging in risky spending habits are only two behaviors that increase your risk of not paying your debts on time. Maintaining your checkbook and paper statements are additional responsibilities that are more difficult when your ADHD symptoms are out of control. Screen dependence. ADHD indeed makes maintaining focus difficult. But the rapid changing of images, comments, graphics, and games on cell phones, video games, and televisions can capture your interest. It can be challenging to pull yourself away from a screen since your brain desires the reward it receives when you're there. Sexual issues. If you experience symptoms of ADHD while having sex, it can be very upsetting. You risk losing focus on your partner and the event as a whole. You might not be able to complete the journey if you lack patience. A successful sex life also requires effective communication, which may be difficult for you. Relationship difficulties. Couples who share an ADHD diagnosis often experience communication issues, especially if the symptoms are not being treated. When your partner tries to deal with certain aspects of your personality, such as forgetfulness or lack of attention, it could feel like they are always bugging you. Emotional lapses. One way that ADHD changes your brain is by making it more difficult for you to control your responses to situations. You can lose control and lash out in frustration or anger. It might also be the reason you obsess over such little matters. Diagnosing adult ADHD. Although there isn't a single medical, physical, or genetic test for ADHD, a skilled mental health care practitioner or doctor who compiles data from several sources can offer a diagnostic evaluation. These sources include standardized behavior rating scales, checklists of symptoms associated with ADHD, a thorough account of past and present functioning, and information gathered from loved ones or close companions who are familiar with the subject. To rule out a possible learning disability, some practitioners will assess cognitive ability and academic accomplishment. ADHD cannot be accurately diagnosed with a brief office visit or a simple talk with the patient. During the clinic appointment, the patient might not always show signs of ADHD. Thus, the diagnostician must conduct a detailed life history. When making an ADHD diagnosis, co-occurring disorders must be taken into account. The DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition, written by the American Psychiatric Association, contains clinical recommendations for diagnosing ADHD. These accepted guidelines are often applied in both clinical practice and research. The physician will try to ascertain whether these symptoms are still present in the adult, and whether they were present in childhood during an evaluation. Adults must exhibit at least 5 of the symptoms to be diagnosed. The presentations of these symptoms in adults may differ from those in children because they can change with time. The DSM-5 identifies 3 forms of ADHD: hyperactive impulsive, predominantly inattentive, and combined. Each condition's symptoms are modified and listed below. ADHD primarily manifests as inattentive behavior, has trouble maintaining focus, doesn't seem to listen, struggles to follow directions, avoids or dislikes tasks requiring sustained mental effort, struggles with organization, loses things, is easily distracted, and is forgetful in daily activities. ADHD is primarily manifested as an impulsive behavior. Acts as if driven by a vehicle. Adults will often feel inside as though a motor drives them. Talks excessively. Blurts out answers before questions have been fully answered. Have difficulty waiting or taking turns. Intrude or interrupting others. Has difficulty remaining seated. Extreme restlessness in adults. Runs around or climbs excessively in children. Difficulty engaging in activities quietly. Combined presentation of ADHD. Both the inattention and hyperactive impulsive ADHD presentations apply to the person. The presentations of these symptoms in adults may differ from those in children because they can change with time. The physician diagnoses ADHD based on the severity and number of symptoms, the duration of symptoms, and how these symptoms hinder functioning at home, school, work, friends and family, or other activities. It is possible to have ADHD without exhibiting any signs of impulsivity or hyperactivity. The clinician must also ascertain whether coexisting conditions bring on or affect these symptoms. A few of the symptoms had to be present before age 12. Typically, a parent or other informant is needed to confirm this. Significant impairment in at least two vital areas of the person's life is crucial to diagnosing ADHD. It is important to emphasize. The term impaired describes how ADHD affects a person's life. Examples of impairment include losing a job due to symptoms of ADHD, going through a lot of stress and distress in a marriage, running into financial difficulties as a result of impulsive spending, failing to make bill payments on time, or being placed on academic probation in college due to poor grades. A person might not meet the requirements for an ADHD clinical disorder diagnosis if they show signs of the illness but do not significantly impede them. Web-based rating scales. There are a lot of websites on the internet about ADHD that include different kinds of surveys and lists of symptoms. Most of these tests are not standardized or scientifically proven. Thus, they shouldn't be used to diagnose ADHD in oneself or others. Only a qualified, legally licensed practitioner may offer a reliable diagnosis. Who can make the diagnosis of ADHD? A doctor or a licensed mental health expert should perform an ADHD diagnostic evaluation for adults. Clinical psychologists, doctors, psychiatrists, neurologists, family doctors, or another sort of physician, or clinical social workers are some of these professionals. Whichever professional type is selected, it's critical to inquire about their education and experience dealing with adults with ADHD. An accurate diagnosis and an effective treatment strategy are often more dependent on the professional's level of knowledge and skill about adult ADHD than the specific professional degree. Professionals with the necessary qualifications are typically open to sharing details about their education and work with people with ADHD. Reluctance to do so in response to legitimate inquiries can be seen with suspicion and may be a sign that the person should consult with another expert. How do I find a professional experienced in ADHD diagnosis? Request a recommendation from your primary care physician for a local healthcare provider with the training and experience necessary to assess adults for ADHD. Calling a nearby university-affiliated hospital, a medical school, or a graduate psychology program for recommendations can also be beneficial. Visiting and speaking with group members might be beneficial if there is an ADHD support group in your region. Many probably have experience working with one or more professionals in your neighborhood and can share information with them. Most insurance plans include a list of specialists by specialization and can help customers who take part in their plans locate a healthcare provider. The Professional Directory of CHADD is one of the numerous websites that identify providers of ADHD services. How do I know if I need an ADD or ADHD evaluation? Most adults who want an assessment for ADHD have serious issues in one or more aspects of daily life. Some of the most common issues include inconsistent performance in careers or jobs, losing or quitting jobs often, a history of academic and career underachievement, a lack of ability to manage day-to-day responsibilities, such as finishing household tasks, maintenance tasks, paying bills, or organizing things, relationship issues as a result of not completing tasks, forgetting important details, or becoming easily upset over minor things, and chronic stress and worry. An expert can establish whether ADHD, another factor, or a mix of factors bring on these issues. Even though certain ADHD signs are visible as early as childhood, some people may not have serious issues until much later in life. For instance, some gifted people might mask their ADHD symptoms and don't have serious issues until they are in high school, college, or are pursuing a job. In other situations, parents may have provided an extremely safe, orderly, or supportive environment, reducing the effects of ADHD symptoms until the child or young adult has started to live independently. What should I do to get ready for the evaluation? Most people have some anxiety and trepidation before having any kind of condition, such as ADHD, tested. This is typical and shouldn't deter people from being tested if they think they might have ADHD or are experiencing serious problems. Unfortunately, many people are reluctant to seek help due to some of the widespread misconceptions about ADHD, such as the notions that it only affects children, or the person is just looking for an excuse. Reviewing old report cards and other educational records from kindergarten or preschool can be valuable to many professionals. If such documents are accessible, they must be brought to the first consultation. You should also bring copies of any test results from earlier psychological evaluations to the appointment. Job assessments for individuals who have issues at work should be brought in for review if they are accessible. Before the evaluation, many experts will ask the subject to complete and submit questionnaires and to name a spouse or other family member who can also participate in certain aspects of the evaluation. The evaluation will go more quickly if the questionnaires are completed and returned on time. What is a comprehensive evaluation? Certain protocols are necessary for a thorough evaluation, even though different physicians will use slightly different testing methods and procedures. The DSM-5 symptom checklists, standardized behavior rating scales for ADHD, a thorough diagnostic interview, information from independent sources like the spouse or other family members, and other types of psychometric testing as the physician deems required are among them. Below, we go into greater detail about these. A diagnostic interview, signs of ADHD. An in-depth history of the person is given during a structured or semi-structured interview, which is the most crucial component of an exhaustive ADHD evaluation. The interviewer uses a predetermined, standardized set of questions to increase reliability and reduce the likelihood that a new interviewer might reach a different conclusion. The physician covers many topics, details pertinent issues, and asks follow-up questions to ensure all relevant topics are covered. The examiner will review the diagnostic standards for ADHD and assess how many of them, both currently and going back to childhood, apply to the subject. The extent to which these ADHD symptoms interfere with the person's life will also be determined during the interview. Checking for further psychiatric disorders during the diagnostic interview. The examiner will also perform a thorough evaluation to check for any other psychiatric conditions similar to ADHD or often co-occur with it. Research has indicated that more than 2/3 of people with ADHD have one or more coexisting conditions, and ADHD rarely happens alone. The most prevalent ones include substance use disorders, learning difficulties, anxiety disorders, and depression. Numerous of these disorders have symptoms resembling ADHD and can even be confused. Coexisting conditions are screened for as part of a thorough evaluation. Any co-occurring conditions must be identified and treated when they coexist with ADHD. Ineffective treatment of coexisting illnesses often results in ineffective treatment of ADHD. Importantly, failing to recognize this might lead to improper ADHD treatment for the patient when the symptoms of ADHD are a side effect of depression, anxiety, or another mental disease. In other instances, managing ADHD will take care of the secondary disorder and eliminate the need to manage it separately from ADHD. The examiner may also inquire about the subject's medical history, early development, academic and professional experiences, driving record, history of drug and alcohol misuse, family and marital status, and social history. The examiner will search for patterns that are typical of people with ADHD, while also attempting to identify potential causes of symptoms that resemble ADHD. Participation of family members. The doctor must speak with one or more independent sources, typically a close relative, spouse, parent, partner, or family member, familiar with the patient. This process does not intend to cast doubt on the subject's sincerity, but rather elicit more details. Many adults with ADHD have hazy or subpar memories, especially from childhood. They could remember certain details, but they might not remember the diagnoses or issues they faced. As a result, the physician might ask the person undergoing evaluation to have their parents complete a retrospective ADHD profile, outlining behavior from childhood. Many adults with ADHD could be only dimly aware of how their behaviors affect others and themselves. Couples who are married or living together will benefit from the clinician interviewing them jointly when reviewing the ADHD symptoms. This approach sets the basis for relationship improvement when the diagnostic process is complete by helping the non-ADHD partner or spouse develop an accurate understanding and sympathetic attitude toward the impact of ADHD symptoms on the relationship. If it is impossible to interview the family members, having them complete symptom checklists is a good substitute. Many adults with ADHD may experience extreme frustration and shame due to the constant issues brought on by the condition. It is crucial that the person undergoing evaluation openly and honestly share these issues and does not withhold information out of embarrassment or concern for backlash. The correctness of the information presented to the examiner will play a significant role in the evaluation's quality and the precision of the diagnosis and treatment suggestions. Standardized methods of rating behavior. A thorough evaluation may use one or more standardized behavior rating measures. Research comparing the behaviors of those with ADHD and those without ADHD is used in these questions. Rating scale results, though not considered diagnostic in and of themselves, are a crucial source of factual data used in the evaluation process. Most therapists ask the subject of the evaluation and the subject's close relationship to complete these rating measures. More testing. Additional psychiatric, neurophysiological, or learning difficulties testing may be required, depending on the person and the issues being addressed. Although they cannot accurately diagnose ADHD, they can offer valuable insight into how it affects the individual. Coexisting conditions, presence, and consequences can also be ascertained through tests. For instance, the clinician will typically administer an intellectual ability test and an academic success test to ascertain whether the person has a learning problem. Inspection of the body. A medical examination is advised to rule out medical explanations for symptoms if the person being assessed has not had a recent physical examination within the last 6 to 12 months. The symptoms of other medical disorders, such as thyroid issues and seizure disorders, might resemble those of ADHD. While a medical exam cannot prove ADHD, it is crucial in helping the exclusion of other disorders or issues. Finalizing the assessment. A written summary or report will be completed after the evaluation, and the clinician will give the person and family their diagnostic opinions regarding ADHD and any other psychiatric disorders or learning disabilities that may have been discovered during the evaluation. After reviewing treatment options, the clinician will work with the patient to develop an effective medical and psychosocial intervention strategy. The clinician will then consult the patient's primary care doctors as necessary. Strategies for finding the right healthcare professional. ADHD can make it challenging for people to focus and regulate their behavior. One of the most prevalent chronic disorders in children, it affects between 3% and 5% of the population. Where do you begin if you or your child has ADHD and needs a specialist's help? There are numerous varieties of specialists, each with a specific field of expertise. Here are some pointers on how to locate the ideal candidate for you. Choosing an ADHD specialist to contact. First, get a recommendation from your primary care physician. They will probably have a list of experts knowledgeable about ADHD and can help treat it. There are various possibilities for finding a specialist if you don't have a regular physician or wish to consider other options. To start, search online. Numerous doctor directories include details on specialties and areas of focus. Another choice is to seek recommendations from friends or relatives. They might be familiar with an expert who has assisted them, or know someone who has. Finally, give your neighborhood mental health facility or ADHD support group a call. They often include a list of local experts that can assist. No matter how you locate a professional, speaking with several before choosing one is crucial. Inquire about their expertise in treating ADHD, their techniques, and the outcomes they've experienced. It's crucial that you feel at ease with the expert and that they know your needs. You can obtain the help you require to manage your ADHD from the appropriate professional. Effectiveness of ADHD treatment. Treatment for ADHD can be useful in easing symptoms and enhancing performance. The most extensively researched treatment for ADHD is stimulant medication, which has been demonstrated to be beneficial in easing symptoms in 70 to 80% of users. Treatments such as behavior therapy, in addition to medication, can be effective in treating the signs of ADHD. People with ADHD are given techniques in behavior therapy to help them manage their symptoms. It may work well for taming impulses, streamlining tasks, and boosting self-control. The average length of time for treating ADHD is several months to years. Working with a specialist is crucial because they can monitor your symptoms and help you identify the best course of action for you or your child. People with ADHD can live fulfilling lives if given the right care. Different types of ADHD experts. Several types of specialists can help treat ADHD. Here are a few examples. Neuropsychologists. Neuropsychologists are experts in identifying and treating brain-related issues. They can help those who have ADHD in recognizing and controlling their symptoms. Clinical psychologists. Clinical psychologists are experts in treating mental health conditions via therapy. They can help those who have ADHD in controlling their symptoms and learning coping mechanisms. ADHD coaches. These professionals are skilled in helping those with the disorder manage their symptoms and achieve their goals. They can help you stay on track with your goals by offering advice, encouragement, and support. Pediatricians. Pediatricians treat ADHD in children and are experts in young people's health. They can also suggest medical professionals who can help in treating adult ADHD. Specialist physicians. A variety of specialists are available to help treat ADHD. Pediatric developmental doctors, neurologists, and psychiatrists are a few examples. Before choosing, it's crucial to speak with multiple experts. Who should make the diagnoses for ADHD? The best person to diagnose ADHD is typically a psychiatrist or other mental health expert who specializes in the disorder. However, the diagnosis might also be made by your family physician. It's crucial to receive an accurate diagnosis to receive the best care. Talk to your mental health expert or doctor if you believe you or your kid may have ADHD. They can assist you in determining the situation and whether ADHD is the appropriate diagnosis. If I have ADHD, should I see a psychiatrist or psychologist? The optimal treatment for ADHD will differ from person to person, so there is no universally applicable answer to this question. There is a misperception that only psychologists provide treatment, and psychiatrists simply administer medicine. This, however, is untrue. A psychiatrist can recommend counseling and medication to people with ADHD, or a person might visit a psychiatrist for treatment and medicine and a psychologist only for therapy. Social workers are one example of mental health professionals who can offer treatment. Speak to your usual doctor or a mental health professional if you are unsure who to visit. They can help you select the best professional for your needs. How do I pick an ADHD psychologist? It's crucial to locate a psychologist knowledgeable about ADHD and with expertise in treating it while searching for someone to help you with your condition. You can check online or in doctor directories, or ask your usual physician for a recommendation. You must feel at ease working with the psychologist you select. You should have confidence in them and feel they understand your circumstance and who you are. Try looking for a different psychologist if you don't think this one is a suitable fit. You should be able to discover an effective specialist because several focus on treating ADHD. How to locate a coach for ADHD. You might want to think about working with an ADHD coach if you need help controlling your ADHD. Coaches have special training to help ADHD patients manage their symptoms and achieve their goals. Finding a coach that is a good fit for you is crucial because there are numerous different types of coaches. A coach can be located online or through professional directories. It is also crucial to speak with numerous coaches before choosing one. To better manage their ADHD, some people may find it helpful to work with coaches. They can help you stay on track with your goals by offering advice, encouragement, and support. How to help someone in locating an ADHD expert. You may do a few things to help someone else find the best doctor if you're looking for a specialist for them. Discuss the person's requirements for a specialist and their demands with them. Assist them in researching various medical professionals and inquiring about their experience with ADHD. If you can, go with them to consultations with suitable specialists. Encourage them to keep looking until they find a doctor who best fits them. Finding the appropriate ADHD specialist can be challenging, but obtaining the right care is important. You can successfully control your ADHD symptoms with the right support.
I hope you're enjoying my audiobook so far. It would be a pleasure if you could let me know how you're feeling about this audiobook in the comment section below. We would greatly appreciate it if you would also like the video and subscribe to United Audiobooks to have access to more best-selling audiobooks in the future. Also, please, if you are interested in getting more free audiobooks, please click the first link in the description below. Now, let us carry on with the next chapter.
Strategies for emotional control. Anyone who has heard of attention deficit hyperactivity disorder, or ADHD, knows that individuals with this condition have difficulty focusing and managing their attention. What is less generally known is that ADHD can also make it difficult to regulate one's emotions, a condition called emotional dysregulation in psychology. According to clinical studies, emotional dysregulation affects as many as 70% of individuals with ADHD. Nearly half of individuals with ADHD receive treatment for depression at some point, and more than 50% have an anxiety disorder. ADHD is also often accompanied by abrupt, uncontrolled, angry outbursts. Let's start by answering the more basic question before discussing how to deal with emotional dysregulation. What exactly does emotional regulation mean? A person can prevent overreacting to emotionally charged situations by exercising emotional management. It enables individuals to control their emotional outbursts and react to difficult events more consciously and calmly. A person's capacity for emotional regulation allows them to change their emotional state to make it more conducive to achieving their goals. On the other hand, emotional dysregulation is the failure to match one's emotions with one's goals. Consider John, an office worker, as someone fighting for a promotion. His supervisor may hesitate to offer him additional responsibility if he often loses his cool in meetings. John will be more successful if he instead employs emotional regulation techniques to control his anger and deal with the symptoms of ADHD. It should come as no surprise that emotional dysregulation in adults with ADHD is linked to a wide range of functional deficits. According to research, those who have trouble controlling their emotions are more likely to hurt themselves or others. Additionally, they are more likely to fail out of school, get divorced, commit crimes, cause accidents, and make poor financial decisions. What causes emotional dysregulation in adult ADHD? Simply put, the prefrontal cortex serves as a crucial function in controlling emotions. Unfortunately, the prefrontal cortex does not work as well in adults with ADHD as in neurotypical individuals. It's a common metaphor to say that people with ADHD have a Ferrari brain and bicycle brakes. In other words, the ADHD brain finds it easy to accelerate, but difficult to decelerate. ADHD symptoms and some mood disorder symptoms are similar. For instance, commencing tasks is difficult for those with ADHD and clinical depression. According to some researchers, variations in specific brain areas, such as the amygdala and prefrontal cortex, may contribute to emotional dysregulation and other ADHD symptoms. The effects of untreated ADHD symptoms can also result in or worsen emotional problems. An adult with ADHD who has not developed executive functioning skills, for instance, may occasionally forget deadlines. Stress arises naturally from the potential outcomes, which range from failing a college course to getting a poor performance review at work. They can increase the anxiety level of someone with ADHD beyond what they can manage. A person's sense of self-worth can be damaged by repeatedly going through unpleasant outcomes, which can also set them up for frustration and depression. How to regulate emotions with ADHD. According to preliminary studies, therapy patients who specifically focus on their emotional dysregulation problems tend to have better outcomes. 10 emotional control techniques for adults with ADHD are provided below. We advise consulting with an ADHD specialist as you try these techniques and determine which ones are most effective for you. Learn to monitor yourself. Keep an eye on yourself in both neutral and emotional circumstances. How quickly can you react? How would you describe your feelings? Does your reaction help you in achieving your objectives? Do you generally have a neutral disposition, or is there occasionally irritability? Self-monitoring is the first step to properly managing emotional dysregulation because many people with this condition have trouble identifying their feelings. Maintain your physical well-being. The consequences of sleep deprivation on adults are generally underestimated, despite everyone understanding that a tired toddler is a cranky toddler. Adults often hide their feelings. However, when we are sleepy, hungry, hot, cold, ill, etc., we get just as cranky on the inside as toddlers. Get enough rest, work out often, and watch what you eat. You can support your psychological health and improve your capacity to handle stress by maintaining good physical health. Learn coping mechanisms and ADHD skills. According to research, a person's capacity to control their emotions improves as their ADHD symptoms do. If you consider it, this makes sense. There will be less cause for anger when your ADHD symptoms stop interfering with your life. Make every effort to lessen the emotional toll that ADHD takes on your life. hold on to reality. We often have negative thoughts while we are under stress. We obsess over negative things that happened in the past and worry about the future. By centering yourself in the here and now, you can keep yourself from getting carried away by these negative thoughts. The next time you notice yourself dwelling on the past or the future, direct your attention to your 5 senses and the environment around you. Use a guided meditation or a grounding technique. You might want to begin a daily mindfulness practice to stop uncontrollable negative thoughts and emotions from building up in the future. Challenge negative thoughts. Negative thoughts might make me unhappy and anxious even when they don't match reality. It is crucial to challenge negative thoughts as soon as they surface. For instance, if your friend doesn't reply to your text immediately, don't think they are upset with you. Consider whether they are busy or their phone's battery needs replacing. Believing someone when they say something regarding emotional control is usually a good idea. The use of medication. Although there is still much to learn, early research indicates that medication may help with emotional dysregulation. Treatment of ADHD symptoms with stimulant medication can improve emotional well-being, since untreated ADHD symptoms can increase the stress a person must manage. Additionally, some psychiatrists advise using SSRIs or other mood-regulating medications to treat emotional problems immediately. To find drugs that treat your specific cluster of symptoms, speak with a professional psychiatrist and ADHD specialist. Schedule some inspiring activities. Often, a person's ability to control their mood is exceeded by a combination of stressors rather than just one. There is a limit to how much stress a person can handle before losing their cool. Set yourself up for success by including activities to help you feel refreshed rather than letting stress and disappointments accumulate. Plan a relaxing activity or a half hour each night if you have ADHD and anxiety. If depression has made you feel down, take a brief morning stroll, tune in to a motivational podcast, or engage in any other energizing activity. Consider your options before acting, or do the opposite of your first impulse. While acting on your emotions while you're emotionally charged can lead to complications, all feelings are natural and valid. Ideally, before responding to whatever is troubling you, take a moment to gather your thoughts, relax, and consider your objectives. Nevertheless, if you have ADHD, it might seem impossible to wait before reacting. I urge you to keep in mind our do the opposite method if you must act right away. Take any action completely at odds with your initial emotional instinct. For instance, give the woman who cut you off in traffic the peace sign instead of swearing at her. Even though it may seem foolish, this tactic has worked well for many people. Develop expertise in something. This method works wonders for ADHD patients who experience depression or a sense of helplessness. Doing things you enjoy helps you feel more confident and deserving of yourself. Doing what you love can lift your spirits and strengthen your fortitude. It will be easier for you to handle setbacks the more mastery moments you have. Distance yourself emotionally from challenging situations. A new viewpoint can help emotional events lose some of their emotional impacts. Try putting more space between you and emotional stimuli to use this method. For instance, if the argument at the table next to you is making it difficult for you to study, move to a table further away. Distancing can also be done in the future. For example, by picturing how you will laugh about an embarrassing incident when you tell your story. You could also put yourself at an objective distance. You might, for instance, consider how one of your finest and most sensible friends would respond if they were present and saw you being mistreated. Why you must be self-aware of your ADHD to take action, change, and progress. By striving to accept who you are, how you think, and what makes your ADHD brain tick, you can unlock great power and productivity. Discover how to make the most of your strengths and develop the plans you require to complete tasks. We want things to change, and we want them to change without any persistent effort on our part. Or we fight our ADHD brains, denying and resisting lifelong realities about how we perform well and how we do not. Or we overthink things to the point that we believe we truly did it. Knowing what to do doesn't make it happen. The core of the ADHD difficulty is the transition from knowing to action. What then triggers genuine change and advancement? Recognizing, rather than fighting, the differences caused by ADHD and accepting who we are. Maximizing our skills and creating workarounds when necessary is made easier by increasing our self-awareness and self-acceptance, the power of potential and choice. Understanding and utilizing our thought processes is essential for strategizing and acting productively. The more we understand the process of change, the easier it becomes. Here are some ways to begin the procedure. Honesty is the first step to ADHD self-awareness. Making a list of your strengths and weaknesses, including who you are and are not, what you are likely to do or not, and how you operate versus how you wish you worked, is the first step in developing self-awareness. You run the risk of creating a life or acting in ways that won't work for you if you lack self-awareness. Knowing who you are and how you operate or don't will help you create tactics to maximize your abilities and compensate for your ADHD issues. You can take action to lessen your frustration triggers if you know them. When you know what gives you energy, you can arrange a time for it. Angie became frustrated because she struggled to integrate exercise into her workday. She decided to go to the gym first thing every day. Although it was a terrific idea, it couldn't be maintained by someone who often had trouble getting out of bed and made it to work late. She enrolled in an after-work workout class, but often skipped it due to her exhaustion from her job. We talked about more sensible options. She left the office for a yoga lesson in the middle of the day, which helped her focus and feel more energized later. She attended yoga with coworkers because it was a social activity, which made it easier to keep the commitment. Practice ADHD self-acceptance. Even if you don't like aspects of yourself, accepting who you are and your thoughts and behaviors will increase your productivity. Set up a space where there are no judgments and let go of your expectations of yourself. You are a singular blend of your personality, background, ADD, LD, IQ, genetics, birth order, abilities, and surroundings. We are less inclined to react and can better act when we embrace ourselves. Break free from the self-critical guilt trap. Instead of allowing us to advance, guilt keeps us mired in a web of failure and regret. According to studies, those who accept themselves are happier and more successful. Recognize your ability to make decisions. Accepting our difficulties does not preclude us from making changes. Stop thinking like a victim. Biology, history, environment, experiences, and other people may worsen our difficulties, but we always have a choice in how we react. Think about what we can do rather than what we can't. You might need to find a solution to a challenge, but the ADHD brain is great at it. Have faith in your ability to think differently. Do your beliefs have any restrictions? When evaluating a circumstance or your skills, are you realistic? Check your perspective. Never rely on your first impulse. Drama appeals to the brain. For us, everything must be either perfect or useless, all or nothing. James was having trouble in college. He adopted the techniques we outlined and changed a number of his habits, but his academic performance remained unchanged. When I asked him if he thought he could succeed, he responded negatively. James felt he couldn't change, which put him in a bind. His grades and self-confidence increased as he tried to change his thinking. Create a roadmap for your brain. Make your goals specific and believe in your ability to change your life. It is less likely that you will complete any of your goals if you try to complete too many at once. Even if you take pleasure in your capacity for multitasking, you cannot simultaneously catch two rabbits. Aaron, a new coaching client of mine, had modified his sleep and waking cycles and was pleased to adhere to a plan to enhance his productivity. But he was irritated by his attempts to master time. He burned out after a while of it working. Why? He tried to adopt behaviors that weren't compatible with his ADHD brain. Together, we looked into more practical options to help him adjust what he wanted, such as creating white space in his daily calendar for unexpected or downtime activities. His sleep and wake cycle gradually changed, and he adjusted. He had enough time for these new actions to become part of him. Less was more. Plan your approach to success. Change happens when objectives are explicit, goals are attainable, and solutions are clear and realistic. Start by saying, I will leave the house by 8:15 every morning so that I can arrive at work relaxed and on time, instead of Aaron's, I am going to master time. The more you understand yourself, the easier it will be to create brain-friendly ADHD coping mechanisms. Consider that each assignment requires two different sets of tactics. The first step is to gather the resources, advice, and methods needed to complete the assignment. The second is to inspire yourself to finish it. Act. Consider what might prevent you from acting, whether external circumstances or internal worries, negative self-talk, avoidance, doubt, a lack of enthusiasm or conviction. Have backup plans in place and always be gentle to yourself. You'll be more equipped to complete tasks if you know and understand how your ADHD brain works. Boosting productivity with ADHD. We've created a list of ADHD tips and methods to increase productivity, improve mood, get more sleep, and combat procrastination. Let's begin immediately. Improving productivity. A wall calendar. A dry erase wall calendar is useful for organizing your schedule. Time blindness is greatly alleviated by writing appointments and deadlines in bold colors and crossing off each day that passes. Use color. People with ADHD are often visual learners. Highlight significant dates, Color code documents, write to-dos on colorful paper, and add stickers or color to practically everything that requires your attention to make things stick in your mind. You may also utilize color coding in Google Calendar to make items stand out. Organize tasks. Do you have a target or due date? Along the process, establish smaller deadlines. This can make you feel more confident and less stressed. Try the Pomodoro technique. Start working on your project. Set the timer for 20 minutes and then stop. Take a 5-minute rest after 20 minutes, then repeat. Put a check mark next to each cycle you complete. Reframing. Reframe tasks constructively or more practically to combat negative mental habits. For instance, if you are putting off starting a project and your initial thinking is, "There is too much work, it'll take so much time," try checking yourself with a less depressing and more realistic thought, like, "If I start this today, I'll feel great, and there will be less work tomorrow." 24-hour hotspot. Set aside a space, such as your workstation, where you can keep track of your need-to-dos. Anything that requires your attention within the next 24 hours should be placed there to prevent loss. Pocket notes. Writing vital things on notes and placing them in your pocket is a safer alternative to writing on your hands. Ensure it's in your dominant side pocket so you're more likely to reach in and retrieve your reminder. Smartphone. Get a smartphone and use the calendar, notepad, and reminder alerts to help you fulfill deadlines. Set multiple obnoxious reminders in the days running up to your deadline. Sleeping better with ADHD. Set a wind-down alarm on your smartphone. Most smartphones let you program a bedtime alarm that will alert you an hour before you plan to go to sleep. Use this signal to start your night ritual. Turn off all electronics and dim the lights. Happy lamp. It might be challenging for many people with ADHD to sleep because of psychological variations in their circadian rhythms consistently. Your circadian rhythm can be improved by using a happy lamp or obtaining 20 minutes of early morning light exposure. Melatonin. Melatonin levels are often decreased in ADHD patients. Try a supplement. 0.3 milligrams is a recommended dosage. Or eat foods that cause melatonin production, such as tart cherry juice. No late lattes. Caffeine takes up to 12 hours for your body to completely digest. Avoid caffeine 5 to 7 hours before bed to get a better night's sleep. Calm your mind. Is your mind racing and keeping you up? Progressive muscle relaxation is one approach that can help you relax and fall asleep. Get noisy. Noise machines might increase sleep quality and duration, particularly pink noise. Imagine rainfall and ocean waves. Keep it cool. Lower the temperature in your room to 65 to 68 degrees Fahrenheit, or 18 to 20 degrees Celsius, which is the optimum range for melatonin generation and sleep. Regular wake-up times. The sleep-regulating system in your body benefits from regular waking up times. Setting a regular wake time is the most practical strategy to keeping a consistent schedule and control your sleep hormones. Sleep mask. Use a sleep mask or blackout curtains to improve your sleep quality because melatonin production is maintained by darkness. Only utilize the bed for sleeping. Otherwise, connections such as bed plus job, bed plus scary movies, or bed plus existential dread may be formed. Sleep therapists refer to this as stimuli control. Only use your bed for sleep and intimacy. Getting chores done. Begin small. Allow yourself the luxury of minor tasks that bring your major goals closer to completion. Does the kitchen need cleaning? Start with a single countertop section. Progress is better than no progress. Always begin with one room at a time, and if necessary, focus on just one area of that room. Apps. Apps for managing your grocery lists include Out of Milk, which uses a basic scanning mechanism. Even family members can sync their lists with yours. Calendar for your daily routine at home. Make things easy by creating a list of tasks you can complete each week. To help you remember which tasks you need to complete on certain days, use a wall calendar and lots of colorful markers. Let your plants live. Track your watering schedule using applications like Happy Plant to keep indoor plants alive. 20-minute rule. The 20-minute rule states that you must wait 20 minutes before enjoying some downtime, such as a Netflix binge. Simply set a timer for 20 minutes and complete the assignment during that period. You can perform the same action repeatedly, such as organizing your room's clothing. If you have a spouse or children, see if you can turn it into a game. Make it enjoyable. Although they may seem overwhelming, chores aren't all that unpleasant. Set the mood by playing upbeat music, donning an attractive cleaning outfit, and concentrating on one activity at a time. Invite visitors over. Nothing inspires you to clean up like a visitor. Try to host dinner or drinks at least once a week, and use that as an incentive to tidy up. Ask for help. If you're feeling overwhelmed, ask for assistance. Reaching out to a loved one might be less intimidating, and occasionally, you need a little motivation to start. Additionally, they might have the time to assist. Put fitness first. Put on your pedometer and commit to using your daily duties as exercise. Look for expired food. Choose a day of the week to remove expired food from the refrigerator. You're starting to feel exposed, aren't you? Managing and minimizing ADHD impulsivity. The 24-hour rule. The 24-hour rule states that you must always allow yourself a cooling off period before making an impulsive choice or signing up for something. Try to wait at least 24 hours before getting started. If you genuinely need it, the desire remains. What will become of this? If you're compelled to buy anything while shopping, ask yourself, where will this live? Stopping to consider where it fits into your life can result in a humble epiphany. Before you speak, say it again. Impulsive actions are challenging to manage. Before responding, try to paraphrase what was stated while you were listening. It will not only clear up any possible misunderstandings, but also allow you a moment to consider your reply. Evaluate yourself. By outlining the circumstance, your feelings just before acting, and what you should do the next time to stop the impulsive behavior, you can practice naming your impulsivity. Consider it a problem that a logical scientist is attempting to solve. Elastic band. Wrap your wrist in a rubber band and snap it whenever you impulse to act rashly. It's a method that can help end unwanted patterns and bring your senses back to the present. Note it. Take a moment to write it down before contributing to meetings or debates. Use a notepad or phone to quickly write down what you want to say and bring it up later if it's still important. Meditate. Practice daily meditation to strengthen your capacity to think things through before acting. You can begin with 2 to 3 minutes daily and work up to 10 to 20. Exercise. Daily activity is a great method to eliminate angst and restlessness, fueling impulsive actions. Aim to spend 20 minutes each day doing something you like. Even a daily walk is sufficient for significant advantages. Practice pausing. When someone is speaking, try to listen intently to every word and then wait 3 seconds before responding. After practicing with a trusted companion, you can test it out in the wild. Apologize. Interruptions do occur. If you interrupt someone, recognize it, say you're sorry, and give them a chance to finish. Describe your motivation if you like. Overcoming procrastination. Lockbox. One of the largest distractions, particularly for those with ADHD, is using a phone. Put your phone away with a timed lockbox when you have important tasks. When you're done, TikTok will still be accessible. Take a look around you. Keeping a distraction-free environment clear is crucial for productivity. Keep the area clutter-free or cover distractions with baskets while you work. Simply do the task at hand. Act as soon as you can. The ADHD mind has difficulty refocusing when life becomes hectic or there are distractions. Take a big breath, put on your disciplined pants, and just do the thing, no matter how annoying it might seem. Get stimulated. ADHD minds often experience a lack of stimulation, which might cause them to forego monotonous jobs in favor of more fun ones. Include a slime kit, relaxing music, a fidget spinner, a workout, a podcast, or anything else that will get you moving. As long as pairing actions advance you closer to your goal, it's acceptable. Try combining L-theanine with caffeine. Combining L-theanine with caffeine can increase caffeine's benefits on focus while calming anxiety. According to studies, this combination enhances the cognitive function and sustained attention of ADHD patients. Positive self-talk. Counter your negative inner voice with one that is upbeat. The maxims, "I tried my best, and that's enough. Nothing is perfect. It's okay to be human." And "I am strong, capable, and I can get through anything," are good ones to try. Hug your inner child. It's common for people with ADHD to feel misunderstood as children. A positive affirmation of your inner child from your adult self will greatly help. Give a gentle embrace of encouragement to your inner child. Try encouraging them and promising to do your best to support and understand them as they navigate life. Clarify your objectives. Define your ultimate goal. Then list the mini goals you must accomplish to reach it. Set a time frame. Concentrate on the first mini goal and focus solely on that. If you're still feeling overburdened, further divide your mini goals. The idea is to start going forward simply. Better control your emotions. Schedule downtime. Allocate a period each week, or perhaps a certain time each day, to accomplish nothing. You can do whatever brings you delight. Blast music, use your phone to drift off, or indulge in a pastime. Scheduling in this do whatever I want time gives much needed downtime structure, preventing you from idling away hours and then feeling terrible. Accept the highs and lows. Accepting your feelings without passing judgment on them can be quite relieving. Whenever you experience great sadness, annoyance, or anxiety, Try not to fight it or seek an explanation. Remind yourself that everything passes in time as you sit with the emotion and let the thoughts come and go without judging them. The worst that emotions can do is make you feel uncomfortable for a little while. Keep a journal. Writing out your feelings and thoughts might help you process them and find peace daily or when angry. Breath work. Anxiety, overwhelming, and frayed feelings are common concerns with ADHD. Try to concentrate on your breathing when you experience these feelings, and take a few slow, deep breaths through your nostrils and mouth. Your parasympathetic nervous system is stimulated, which reduces the stress reaction in your body. Take a break. When you feel irate, annoyed, overstimulated, or prepared to lash out, take a break. Take a walk. Sit quietly. Put on some relaxing music in your headphones, or do anything that makes you feel peaceful. Feel free to withdraw from circumstances so you can look after your mental health. Learn to be polite. How your brain is structured makes it difficult to plan, pay attention, hold your tongue, and carry out daily duties. When things go wrong, try to open a discussion with yourself rather than being rude to yourself. Consider using expressions like, "Okay, ADHD, you win this round." Find your tribe. Surrounding yourself with like-minded individuals is crucial. Try sharing materials about ADHD with your present circle if they are open to it, or describe what it's like for you. Online forums, Instagram profiles, and support groups for ADHD are resources you can use to feel heard and understood. Hire a therapist. Therapy can help develop self-acceptance and emotional management skills. Think of therapy as individualized brain training. Sometimes you need a little direction to get things in shape. Now that many internet possibilities exist, treatment is more accessible and affordable than ever. Self-care. Determine your triggers. It's critical to understand your triggers. Plan for the sounds, situations, and even individuals that make you feel stressed and frustrated. Simple solutions include having earplugs or headphones at hand. Plan a meal. Skipping meals and binging are bad habits that are difficult to change. No matter what, try your best to eat a protein-rich meal or drink in the morning. It will help you control your hunger and ensure your body gets the ingredients necessary to produce substances like dopamine. Hygiene. Maintaining hygiene practices can be challenging, but at other times you're rocking 25-step skincare regimens. When you're struggling, try simplification. Use dry shampoo, find an accountability partner, and be polite to yourself about the highs and lows. Stains happen. ADHD causes stains. It's a life of stains. Save your favorite garments by learning how to remove stains effectively. Include yoga. Even 10 to 15 minutes a day can significantly impact your well-being and ability to handle frustration and stress. Add this affirmation. You'll experience challenging days occasionally. Try saying to yourself again, "Now is not forever. Be here now." Practice gratitude. Create a reminder on your phone to practice gratitude simultaneously daily. Stop what you're doing when it goes off and consider something you are sincerely grateful for. Try to focus on it for only 60 seconds. When you're feeling low, indulge. Permit yourself to wear a face mask, eat a hearty snack, and watch your favorite show. You should occasionally reward yourself for a romantic evening with yourself. don't feel guilty about taking the time you require. You are not being selfish. Create boundaries. It's challenging to refuse. Permit yourself to decline an invitation or withdraw if you agree to anything without giving it much thought to avoid exhausting yourself. Remove your cape. Being a superhero is entertaining, but you risk losing yourself. You are not required to take care of everyone or to be flawless. Try to be realistic about how much balancing you can manage, and keep saying, I am human. Love yourself. Love yourself by sticking a sticky note with a positive affirmation on a mirror you see daily. Make sure it's placed so you can read it all the time. Start with a statement like, I am enough, and change it up often to cultivate subliminal love and adoration for yourself. You deserve it. Navigating relationships with ADHD. While attention deficit hyperactivity disorder, ADHD or ADD, symptoms of distractibility, disorganization, and impulsivity can cause issues in many areas of adult life, these symptoms can be especially harmful to your closest relationships. This is particularly true if ADHD symptoms have never received a thorough diagnosis or treatment. Being the one with ADHD, you could experience frequent criticism, nagging, and micromanagement. Nothing you do appears to satisfy your spouse or lover, regardless of what you try. You shun your partner or say everything necessary to get them off your back, since you don't feel appreciated as an adult. You wish your partner would let up just a little and stop trying to manage every area of your life. You're curious about the one you fell in love with. Being in a relationship with an individual with ADHD can make you feel isolated, underappreciated, and overlooked. You're sick and tired of being the only one in the relationship who must care for things independently. You doubt your ability to rely on your spouse. You are compelled to issue repeated reminders and demands, or else just do the work yourself because they never seem to follow through on their commitments. Sometimes it seems as though the person you're dating just doesn't give a damn. It's easy to understand how the emotions on both sides could contribute to a negative feedback loop in the relationship. In contrast to the non-ADHD partner's complaints, nagging, and growing resentment, the ADHD partner feels defensive and withdraws after feeling judged and misunderstood. No one is satisfied in the end. However, things don't have to be this way. Understanding how ADHD affects your relationship and how you may make more positive and useful decisions about handling difficulties and interacting with one another will help you create a healthier relationship. These techniques can help you and your partner communicate more effectively and grow closer. The impact of ADHD on adult relationships. Understanding how ADHD affects your relationship is the first step towards transforming it. You can discover more effective ways of responding once you can recognize how the symptoms of ADHD are impacting your interactions as a pair. This means the ADHD partner is learning how to control their symptoms. This requires the partner who does not have ADHD to practice responding to their partner's frustrations in ways that uplift and inspire them. Here are some relationship issues that ADHD symptoms can bring on. Difficulties with attention. Your partner may feel ignored and undervalued if you lose focus during conversations if you have ADHD. Additionally, you can carelessly agree with something you later regret or omit key information, which can frustrate your loved one. Forgetfulness. Even when paying attention, someone with ADHD may later forget what was promised or talked about. Your spouse can begin to believe you don't care or are untrustworthy when it's their birthday or the time to pick up the formula you promised. A lack of organization. This may result in a lack of productivity and general disorder in the house. Partners may feel as though they are doing an excessive amount of household work and cleaning up after the person with ADHD. Impulsivity. You might blurt out remarks without thinking if you have ADHD, which might harm people's feelings. This impulsivity can also result in carelessness and even reckless behavior, such as making a large purchase that wasn't planned for and setting off arguments about money. Emotional rants. Many people who have ADHD struggle to control their emotions. You can be easily irritated and find it difficult to hold rational conversations. Your partner could feel they must tread carefully to prevent conflicts from erupting. Put yourself in your partner's shoes. Learning to see things from your partner's viewpoint is the first step towards salvaging your relationship. You might believe that you already understand your partner's perspective if you've been together for a while, or if you've often had the same arguments. But be mindful of how easy it is to misjudge your partner's behavior and intentions. Even if only one of you has ADHD, you and your partner are more different than you might realize. Furthermore, simply because you have heard it all before does not imply fully understanding what your partner is saying. It can be particularly challenging to maintain objectivity and perspective when emotions are running high, as they often do while dealing with ADHD relationship concerns. By asking questions and paying attention, you can best imagine yourself in your partner's position. Find a time when you're not already upset to sit down and discuss. Allow your spouse to express their feelings without interjecting to explain or justify yourself. When your partner is finished, summarize what they said and check your understanding by saying it out loud. To help you think about the points later, you might want to write them down. It's your turn after your partner is done. Ask them to do the same for you as you pay attention with open ears and a fresh perspective. Below are some proven ways on how to improve your relationship's understanding. Learn about ADHD. It will be easier to know how ADHD affects your relationship as you both gain more knowledge about the disorder and its symptoms. You can notice that a light turns on. So many of your problems as a pair are now clear. It can be possible for the non-ADHD partner to take symptoms less personally by remembering that an ADHD brain is hardwired differently from a brain without ADHD. Knowing the cause of some of your behaviors and that there are measures you can take to regulate your symptoms might be a comfort for the partner with ADHD. Recognize the effect your actions have on your relationship. It's critical to understand how your untreated ADHD symptoms impact your relationship if you are the one who has it. If you're a partner who doesn't have ADHD, think about how your nagging and critiquing make your partner feel. If you don't like how your partner brings it up or responds to you, don't ignore or discount their complaints. Distinguish your partner's symptoms or actions from who they are. Consider your partner's forgetfulness and lack of follow-through as signs of ADHD. Rather than calling them irresponsible, remember that symptoms aren't personality traits. The non-ADHD partner also experiences the same thing. Recognize that nagging rarely results from an uncaring partner, but rather from feelings of tension and dissatisfaction. How the partner with ADHD often feels. People with ADHD often perceive the world in a difficult way for others to relate to or understand, because their minds are always racing. Here are some ways the partner with ADHD often feels. overwhelmed by the ongoing stress brought on by ADHD symptoms, whether covertly or outwardly. Much more work is involved in maintaining daily order than most people realize. ADHD can make someone feel like they are fighting to keep their head above water, even though it isn't always obvious. Subservient to their partners. Their partners often rebuke them or take charge of the situation. The criticism makes them feel inept and often fosters a parent-child dynamic. Men may feel emasculated as a result of these interactions. Shamed. They often conceal a lot of shame, sometimes making up for it with bluster or withdrawal. Unwanted and unloved. The constant reminders from partners, employers, and other people that they should change just serve to confirm their unlovability as they are. Fearing future failure. There is a greater chance of failure punishment as their relationships deteriorate. But this partner will eventually fall short because of their inconsistent behaviors brought on by ADHD. Reluctance to try is a result of anticipating failure. A yearning for acceptance. People with ADHD often have a strong emotional need to be accepted for their flaws. How the non-ADHD partner often feels. Unwanted or unloved. Instead of being regarded as a distraction, the lack of attention is seen as a lack of interest. Being cherished and getting the attention from one's spouse that this entails is one of the most popular fantasies. Irate and emotionally numb. Many conversations with the ADHD spouse are tinged with anger and bitterness. This anger can occasionally be seen as disconnected expressions. Some non-ADHD partners try to bury their emotions inside to control hostile confrontations. A great deal of stress. The non-ADHD spouse often shoulders the lion's share of the family responsibilities and can never relax. Due to the ADHD spouse's erratic behavior, life could end abruptly at any moment. Offended and ignored. A non-ADHD spouse finds it puzzling that the ADHD spouse doesn't act more often on their knowledge and suggestions when it is clear what needs to be done. Depleted and worn out. Too many obligations fall on the non-ADHD spouse, and no amount of effort seems to be able to mend the marriage. Frustrated. A non-ADHD spouse could think that the same problems keep resurfacing, a boomerang effect. Taking responsibility for your role. It's time to take ownership of your part in the relationship when you've put yourself in your partner's shoes. You can progress once you acknowledge your role in the issues your relationship is experiencing. The non-ADHD partner is also affected by this. The symptoms of the ADHD partner may be the cause of a problem, but they are not the only factor. How the non-ADHD partner handles the annoying symptom can foster understanding and compromise, or lead to misunderstandings and resentment. If you have ADHD, you are responsible for responding to your partner's worries. Your response can make your partner feel heard and affirmed, or ignored and rejected. Break free from the child-parent dynamic. With the partner without ADHD playing the parent and the partner with ADHD playing the child, many couples feel stuck in an unproductive parent-child connection. It often begins when the partner with ADHD doesn't complete responsibilities, including forgetting to pay the cable bill, piling clean laundry on the bed, or failing to pick up the kids after promising to do so. More and more domestic duties are being assumed by a partner who does not have ADHD. They grow more resentful as the partnership grows more unbalanced. It becomes more difficult to recognize and value the ADHD spouse's strengths and contributions. The ADHD partner is aware of this, of course. They begin to believe there is no use in making an effort and write off the non-ADHD spouse as demanding and difficult to please. How can you then change this pattern? Tips for the non-ADHD partner. You can't control your spouse, but can manage your actions. Stop the nagging and verbal abuse right away. Neither produces outcomes. As your partner makes strides, congratulate them and recognize their efforts. Concentrate more on your partner's intentions than their actions when possible. For instance, someone might become distracted while listening to you, but that doesn't imply that they don't value what you have to say. Refrain from trying to parent your companion. Both your relationship and your spouse will suffer as a result of it. Tips for the ADHD partner. Admit that your ADHD problems are affecting your relationship. It goes beyond the simple fact that your partner is unreasonable. Examine the available therapies. Your companion will be less demanding as you develop the ability to control your symptoms and increase your dependability. If you and your spouse find that intense emotions are derailing your chats, decide beforehand that you both need to take a break to collect your thoughts and relax. Look for methods to spoil your partner. Your partner will feel less like your parent if they perceive that you provide for them, even in little ways. Start communicating and stop fighting. As you've already seen, communication between partners often deteriorates when ADHD is present. One spouse feels overworked. One of them feels under attack. Instead of solving the problem, they wind up arguing with one another. Do what you can to calm irrational emotions to better communication. If necessary, wait until you are calm before bringing up a topic. Pay attention to what your partner has to say when you're talking. Consider what the fundamental issue in your argument is. What is the bigger problem? For instance, a couple fights due to the hour-late dinner. The husband, who does not have ADHD, is upset for reasons other than having nothing to eat. He is annoyed by his wife's unreliability and indifference. I work hard to support her. Why do I never receive any care? She would exert more effort if she cared about me. The wife with ADHD feels overburdened and unfairly criticized. I have too much housework to do. I'm finding it difficult to stay organized, and I've lost sight of time. How does that make me a bad wife? Finding a solution is much easier once you've located the real problem. If the husband in this scenario understood his wife's persistent tardiness and disarray weren't personal, he would be less annoyed. This is a sign of untreated ADHD. The woman will be more motivated to make it happen for her side once she realizes that a punctual meal makes her husband feel cherished and valued. Don't hold your feelings within. Whatever your feelings may be honest about them. Bring things to the surface to resolve them together as a pair. You can't read people's minds. Don't presume to know what your partner is thinking. Avoid the "if my spouse loved me" pitfall. If your partner does something that annoys you, talk to them instead of stewing in silence. Watch your language and delivery. Avoid using critical language or asking your partner, "How many times do I have to tell you?" or "Why can't you ever do what you said you would?" Discover the humor in the circumstance. Laugh at the inevitable misconceptions and miscommunications. Laughter eases strain and strengthens your relationship. How to communicate better if you have ADHD. ADHD symptoms can obstruct communication. You can improve your talks with others and your relationship by using the following advice. When you can, talk to people face to face. Nonverbal indicators like eye contact, voice inflection, and gestures convey much more information than words. You must speak to your spouse face to face rather than over the phone, text, or email if you want them to understand the emotion hidden beneath the words. Don't interrupt and pay attention. Try to keep your eyes on the other person while they are speaking. Repeat their words whenever your attention stops keeping up with the conversation. Try to refrain from interjecting. Ask questions. Ask the other person a question instead of launching into whatever is on your mind, or the many things on your mind. They'll know you're paying attention if they see it. Request a repeat. As soon as you become aware that your focus has diverted, apologize to the other person and urge them to restate what was just stated. It will become more difficult to reconnect if you let the conversation drag on for too long while your thoughts are elsewhere. Control your emotions. If you find it difficult to talk about some topics without losing your cool or saying something you'll later regret, think about trying mindfulness meditation. Regular mindfulness meditation can give you more control over your emotions and stop the emotional outbursts that can be so harmful to a relationship, in addition to helping to reduce impulsivity and increase attention. Working together as a team. There is no reason why you can't have a healthy, mutually satisfying relationship, even if one spouse has ADHD. The secret is to develop teamwork skills. A healthy relationship entails giving and receiving, with both parties fully cooperating and actively seeking ways to help one another. Spend some time figuring out what you're good at and what challenges you the most on both sides. If your spouse is strong in a role you aren't, they can step up to the plate, and vice versa. It ought to feel like a fair trade. Think of ways to acquire outside help if you and your partner are weak in the same area. If neither of you is financially savvy, you can hire a bookkeeper or look into money management applications that make budgeting easier. Stick to your division of labor. While you manage the kids and the cooking, the partner who doesn't have ADHD may be more suited to take care of the bills and do errands. Plan weekly meetings. Meet once a week to discuss problems and evaluate your development as a couple. Consider the labor division. If one of you is carrying most of the load, list tasks and obligations and rebalance the workload. Outsource, automate, and delegate. You don't have to handle everything by yourself or with your partner. Give your kids chores if you have any. Additionally, you can think about getting a cleaning service, ordering groceries to be delivered, or setting up automatic bill payments. Split up specific tasks if necessary. The partner who doesn't have ADHD may need to take over as the closer if the partner with ADHD struggles to finish things. To prevent resentments, take this into account in your arrangement. Make a workable plan. You're probably not very good at planning or creating systems if you have ADHD. However, that doesn't imply that you can't stick to a strategy after it has been established. A partner who doesn't have ADHD can greatly help in this area. They can help you create a strategy and routine that will help you stay on top of your obligations. First, analyze your argument's most common topics, such as household duties or persistent tardiness. Then, consider doable solutions that you can implement. A large wall calendar with checkboxes next to each person's daily activities can be useful for remembering chores. You may create a calendar on your smartphone with timers to remind you of future events if you are often late. Assisting your ADHD partner. Establish a routine. The additional structure will be advantageous to your companion. Consider setting up specific times for meals, exercise, and sleep, as well as the tasks you and your partner must complete. Put external reminders in place. This can be a to-do list on your phone, a dry erase board, or sticky notes. Manage the clutter. Although people with ADHD often struggle to become and remain orderly, clutter further heightens the sense that their lives are out of control. Assist your partner in creating an organization and clutter control system. Requests should be repeated to the ADHD partner. Ask your partner to reiterate your agreement to prevent misunderstandings. Thriving in the workplace with ADHD. Employers look for candidates and employees with excellent focus, attention to detail, quickness, and organization. However, if you have ADHD, doing all of these tasks and more might be quite challenging. It can be hard to put forth good work and keep a job consistently. You might have agitation or difficulty concentrating, typical symptoms of the disorder. However, there are steps you can take to overcome your ADHD and succeed in the workplace. It can occasionally be advantageous. How does ADHD affect employment? According to estimates, 8 to 9 million adult Americans have ADHD, and a lot of other people who are in comparable circumstances struggle at work. In contrast to 72% of individuals without ADHD, just 50% of adults with ADHD could maintain full-time employment, according to a national poll. Even when they managed to land a job, they often made less money than their contemporaries who did not. These employment issues result in annual income losses of close to $77 billion. The severity of your ADHD will determine how much of it affects your employment prospects. Some individuals could just struggle to stay on target, while others struggle to go through the workday without having a major argument with a boss or coworker. Some more badly impacted people may lose jobs, find themselves changing jobs frequently, or need to apply for disability benefits. ADHD impacts performance at work in a variety of ways. Meetings may be unbearable if you have problems staying focused and can't sit still. It cannot be easy to keep track of numerous projects and deadlines. According to one study, patients with ADHD often struggled more with verbal fluency, working memory, attention, and other cognitive skills. All of these are executive function skills, which are crucial in the job. If you have ADHD, you can find it challenging to manage your time, get and remain organized, pay attention, follow instructions, finish tasks, pay attention to details, arrive at work on time, speak only when it's your turn to speak, sit quietly, and maintain emotional control. Additionally, you can struggle with procrastination and wrath. Depression and low self-esteem are common side effects of ADHD. These feelings may worsen if you cannot meet deadlines and finish your assignment on time. How can you get and keep a job? Many fidgety adults who have trouble focusing or have other symptoms have never received an official diagnosis of ADHD. Consultation with a medical professional specializing in adult ADHD should be your first step if you have any of the above-mentioned issues. They can speak with you to find out whether you do have it. And if you do, get diagnosed so you can begin the appropriate course of treatment. Medication, therapy, or a combination of the two can help people. You can practice organizational techniques after learning them from a coach or occupational therapist. Work with a career counselor to identify the position that most closely matches your interests, needs, and skills if you are about to begin your job hunt. That could look for faster-paced work, more flexible hours, and a looser structure. Alternatively, you might wish to launch your own company so that you can choose your working conditions and hours. Try these things when you land a job. Make peace. Ask to work in a quiet place where you won't be easily distracted. Team up. Work with a structured manager or coworker who can help you see initiatives through to completion. Plan it. Keep a daily planner that includes a calendar and a to-do list. Continue to update them. Make plans to get electronic reminders for appointments and due dates from your computer or smartphone. Put it in writing. During meetings and phone calls, make notes and list any new duties. Schedule interruption. Plan specific times to respond to voicemail and email daily to prevent distraction. Set attainable goals. Organize your days into discrete tasks and only attempt to do one at a time. Set a timer to help you know when to move on to the next task. Gratify yourself. Find a way to treat yourself after you finish a task, or use these time management tips. Go for a stroll during a break. Read an article from a magazine. For major goals, treat yourself to a special lunch or purchase something you've been craving. Delegate. Get an assistant or intern to handle the little things if you can, to free up your time so you can concentrate on the larger picture. Make it a habit to relax. Develop your relaxing skills. They can help in improving concentration. Try deep breathing or meditation. Every hour, get up to go for a stroll, get a drink of water, or chat with a coworker. Hire a career counselor or executive coach to help you adjust to your new position. They can provide you with advice on any problems you run into. They can also assist you in resolving the problematic work scenarios you encounter. For instance, they could assist you in role-playing how to talk about a salary raise with your supervisor without the discussion becoming tense. Super strengths of ADHD adults you need to know. Few individuals think adults with ADHD have strengths because of how society views the disorder. You may also be disheartened because you only perceive weaknesses with ADHD. But you also need to be aware of ADHD's advantages. Many entrepreneurs and celebrities with ADHD succeed thanks to these traits of ADHD adults. ADHD is often viewed as a drawback. People notice this because they only pay attention to flaws. You should be aware of the shortcomings of adults with ADHD. Just be careful not to let your flaws consume you. Don't only focus on your flaws. To succeed in any environment, identify and learn the strengths of adults with ADHD. Creativity. A mind that is constantly thinking and creating is a mind that is never at rest. Creative energies are necessary for growth. Unsurprisingly, adults with ADHD thrive on and produce creative energy. Some individuals believe that people with ADHD greatly benefit from their artistic skills. This is how you ought to view creativity as well. Adults with ADHD often think outside the box. They flourish in situations that call for creative thought. The creative energies of many people with ADHD benefit countless enterprises and our society. Innovation. Adults with ADHD like to push the envelope. Adults with ADHD often become bored and quickly distracted. While in certain areas, distraction and boredom ruin careers. In other cases, they spark remarkable inventions and scientific achievements. One of the enormous advantages that people with ADHD have is innovation. Adults with ADHD have trouble accepting the way things are. To reiterate, this can destroy a career track professional in the wrong industry. Adults with ADHD should avoid employment that involves intricate duties, a lot of organization, or that keeps them confined to a desk all day. Some of the worst careers for restless minds include being an accountant or an administrative assistant. On the other hand, people with ADHD who are innovative and creative can excel in creative industries. Adults with ADHD may consider occupations that require ingenuity, such as acting, self-employment, and sales. The best careers for adults with ADHD are those in this category. Hyperfocus. Many people with ADHD struggle greatly when they are unable to focus. However, the opposite of lack of focus is hyperfocus, which appears to be one of the strengths of individuals with ADHD. Adults with ADHD may find it difficult to pay attention to particular activities. Other hobbies snag adults with ADHD and won't let go. You must develop the skill to employ hyperfocus to its full potential. To use hyperfocus to your advantage, you must figure out how to manage and harness your ADHD. Many problem-solving oriented jobs lend themselves well to hyperfocus. Science and technology-related careers benefit greatly from the participants' capacity for hyperfocus. Adults with ADHD do well in their careers as scientists, game and computer developers, or athletes. Entrepreneur David Neilman and professional golfer Bubba Watson are two examples of hyper-focused people with ADHD. Exuberance. The high energy that takes up most of their day is lamented by many parents of children with ADHD. Just keeping up with their hyperactive toddler is a problem for them. However, when used effectively, high energy can be one of people with ADHD's major assets. High energy, combined with hyperfocus, gives some researchers and inventors the drive to keep working long after the peers give up. Unfocused hyperactivity can overburden the dynamics of a household. However, high energy drives successful jobs and creative forces when properly channeled. Efficiency. One of the main outcomes of hyperfocus and high energy is another one of ADHD people's productivity strengths. While adults with ADHD struggle with boredom and low productivity, the opposite can occur under the right circumstances: high productivity levels. Adults with ADHD can accomplish outcomes at a special rate when focusing on a crucial problem. Adults with ADHD have an active mind, constantly switching between tasks and thoughts. For most ADHD people, focusing and directing their mental energy is key to enhancing productivity. With the right management, productivity can become a major asset, and you could even claim that ADHD boosted your productivity. The positive side of ADHD at work. If you work for a larger organization, they are prohibited from discriminating against you because of your condition, because ADHD is regarded as a disability under the Americans with Disabilities Act. The law also mandates that your employer meet your needs. However, you must feel comfortable disclosing to your employer that you have ADHD. Doing more research on this subject could be helpful before bringing it up, so you have a strategy. Finally, benefit from ADHD's potential advantages. Yes, there are advantages. The relentless drive to try new things, restlessness, and impulsivity can be wonderful traits. This is particularly valid if you operate your own company. According to studies, many adults with ADHD become business owners. Finding a career that fits you best is the key to success. Then, to maximize your job, employ your drive, inventiveness, and other strengths. Conclusion: ADHD can negatively impact performance at work or school and personal relationships if it is not properly diagnosed and managed. It's challenging to have ADHD as an adult, but with the right lifestyle changes and care, you can significantly lessen your symptoms and enhance your quality of life. Adult ADHD coping mechanisms can help individuals overcome the issues that impulsivity, hyperactivity, and inattention can lead to. Eliminating distractions while driving can improve safety, while adding reminders to your calendar can help you remember things, and organizing your environment can help you avoid losing important items. A person's symptoms, medical history, and occasionally the findings of psychological testing are used by doctors to make an ADHD diagnosis. People who obtain a diagnosis can benefit from medications and other forms of treatment to control the condition. When you have ADHD, you can modify your schedule and finish things in various ways. The good news is that they extend beyond what you've read in this book. If you find it difficult to stay on track, a mental health expert can help you develop solutions for your needs. Introduction. Everyone has been in this situation, sitting at a desk with a deadline and an unfocused mind. Despite significant tasks, you find it difficult to focus on the job. You've tried everything, yet nothing has changed. You need to focus on the current work. You're motivated to finish it, but you just can't concentrate. Maintaining concentration for more than a few minutes at a time is impossible. It's not just you. It would be a vast understatement to say that distractions have worsened in the last 10 years. With our iPhones, we are all carrying about a continual source of distraction. The ability to focus continuously throughout the day is really difficult. The good news is that there are tried and true techniques for improving concentration. The inability to concentrate on the task at hand is one of the disorders of our time. Everyone wants to learn how to concentrate and focus more efficiently. Nevertheless, given the benefits of increased focus and concentration, it is a problem that warrants addressing. In the rapidly evolving digital world, it is getting harder and harder for our brains to focus on one major task at a time. However, with the right mindset and some effort, you can train your mind to block out distractions and remain present. Whatever the size of the work, success depends on understanding the benefits of maintaining concentration. It might also enable you to identify areas for professional development. Learning to focus and concentrate can be challenging. Of course, most people are interested in finding out how to focus and concentrate better, but carrying it out? Focusing might be challenging because of the continuous distractions we face in our noisy society. Fortunately, the best strategies and cutting-edge research on how to concentrate are presented in this book. We'll explain the science behind paying attention to what is important and keeping your mind fresh. This book should have all the information you require, whether you are trying to focus on your personal or professional goals. Understanding focus and its impact on productivity. How often have you tried to concentrate on something only to realize that your mind is off doing something else? You try hard to focus, but you simply can't get it. This common, annoying circumstance has happened to all of us, and it can seriously impair our work. This chapter explores the power of focus, the hidden costs of not paying attention, and the advantages of developing a focused mindset. What is focus? By default, you must overlook many other things to focus on one thing. Here's an improved formulation. Only when we have decided to accept one choice and reject every other alternative can we begin to focus. In other words, focus requires elimination before it can happen. In other words, what you don't do determines what you can do. Although a current no is necessary for focus, a permanent no is not necessary. Focus necessitates focusing on one thing at a time, but you can always do something different afterward. Saying no to all other options frees you up to complete the one task left, which is why focus is the key to productivity. What can we do then to disregard the things that don't matter and concentrate on the things that do? Why can't I focus? Many people often ask this question. You've probably asked yourself this question if you often try to multitask or have trouble finishing even the smallest activities. And often, the solution is found in the things you do every day and in those things you can control. These can include your bedtime routine and sleep hygiene, not getting enough sleep, skipping meals, or not eating enough calories throughout the day, having your phone or other electronics in your line of sight, having dependents or coworkers who need your attention, having your day planned in a way that is out of sync with your ultradian rhythm, being overly stressed or burned out, or not getting enough exercise during the day. These are just a few causes of why you could find it difficult to focus, and they mainly fit into 5 main groups or factors. 5 common factors of poor focus and concentration. These 5 customs and elements can affect your capacity for concentration. 1. Distraction. We are continuously bombarded with both new and out-of-date information when doing anything. According to a study, because our brains are designed for this distraction, the sheer sight of our smartphone impairs our ability to focus. We continuously assess the data to determine whether it is required, sufficient, or meaningless. The amount of information makes it difficult to determine whether we need more information to make decisions. 2. Insufficient sleep. According to scientists, reduced attentiveness, slowed mental processes, and reduced attention have all been associated with sleep deprivation. It's possible to lose your bearings and find it difficult to focus. Your ability to complete tasks, especially those that call for logic or reasoning, could be significantly hampered. Chronically poor sleep negatively impacts your concentration and memory. If you cannot focus on it, it is doubtful that something will stick in your short or long-term memory. 3. Insufficient levels of exercise. Have you ever noticed how engaging in rigorous exercise makes you feel more calm and energized all day? Your muscles could become tight if you don't undertake any physical activity. Your neck, shoulder, and chest could feel tight, and such a continuous, mild discomfort can impair your ability to focus. 4. Improper eating habits. How we eat impacts how we feel all day, including how alert and focused we are. If we don't feed our brains the proper nutrition, we may experience symptoms like forgetfulness, fatigue, and lack of focus. Low-fat diets can impair concentration because the brain requires specific necessary fatty acids. Other restrictive diets could make it difficult to pay attention because they deprive the brain of the nutrients it needs or make you hungry or uncomfortable. all distracting in and of themselves. 5. External variables. The surroundings can influence your focus depending on what you are doing. Excessive noise is an issue, but many individuals also have trouble focusing when it is too quiet. The type of noise affects more than the overall quantity. While the overheard chat of two coworkers may distract, a coffee shop's energetic, anonymous hum may help. While less pronounced instrumentals may keep you focused on the activity, your favorite song may quickly have you singing along, delightfully diverted. Your vision might be harmed by either too bright or too faint lighting. Uncomfortable conditions result from a hot or cold environment. These factors can affect your ability to focus. Fortunately, they are all addressed. Conditions related to concentration. If you consistently have trouble focusing your thoughts, a cognitive, medical, psychological, behavioral, or environmental factor could be at play. You may have to temporarily accept that your focus is poor and learn a few tips to lessen the effect, depending on the cause, or accept the dips as they occur. Consult a professional if you need assistance with concentration and believe your issues go beyond those mentioned above. Cognitive. If you notice that you forget things easily, your attention may suffer. You occasionally experience memory loss, misplacement, and trouble recalling recent events. Another sign that your cognitive function may be affected is if you experience multitasking or an overactive mind due to worries or significant occurrences. Concentration is hindered when situations and thoughts nag your mind, demanding your attention. Psychological. It's hard to concentrate when you're down and out of sorts. Similarly, it may be challenging to focus on a single task while you are grieving the loss of a loved one during grief or when you are feeling anxious. Medical. Our ability to concentrate might be affected by medical conditions like diabetes, hormonal abnormalities, and low red blood cell counts. Additionally, some medications cause drowsiness or bleakness and seriously impair focus. Environmental. An unfavorable working environment, shared areas, and stressful or unpleasant workplace interactions may also cause a loss of attention. We will find it challenging to concentrate when we are emotionally exhausted from burnout or stress from work or personal life. The same is true for the effects of the environment on our bodies, some of which we are conscious of, such as heat, light, and noise, and others that we are less conscious of, such as tension, negativity, and monitoring. Lifestyle. Concentration can be impaired by exhaustion, hunger, and dehydration. Too many missed meals, fatty foods, or excessive alcohol consumption can all affect our memory and impair our ability to focus and pay attention. Benefits of cultivating a focused mindset. If you are focused, you will feel more optimistic and in charge of your life. Understanding your priorities will be the seed that will help you decide where you want to be in life. Being dedicated to achieving your goals is a skill. Focusing on the attainment-related components will clarify what you need to perform. Keep working at it, because to be more productive and realize your dreams, you must maintain your focus. Ultimately, you'll have better possibilities and be happier with your decisions and life. Your dedication and practice will decide the reward you receive. Nevertheless, these are a few of the advantages you will enjoy. You'll experience greater control. To pay attention to your strategy and manage the daily distractions that life places in your path, you must become more focused. Unexpected events will inevitably occur, but you will be more equipped and competent to handle them. It would be absurd to imply that nobody ever has insecurities and doubts, lets them feel them, and gains knowledge from them. Keep your plan in mind at all times and stick to it. However, remember that even if things don't go exactly as planned, you'll still figure out a method to fix them. It's up to you to prepare for every eventuality. You'll have more optimism. Be assured in your abilities and what you know you can do. Your aims will be supported by positivity and increasing your optimism. Your mental health will motivate your resolve, which will help you realize your goals. Tell yourself you can do it, and believe it. Your small victories will motivate the upcoming challenges, which will help you complete the more difficult jobs. Recognize your efforts. The foundation of your future successes will be laid by having a plan and matching focus to attain your goals. You'll gain a deeper understanding of who you are. Embrace your inner self. You will become stronger over time due to your development, progress, and pursuit of any goal. Think back on your path consciously. Even if things don't go as planned, seek the lessons and take what you can from them. Will you find a way through, or will you completely give up? A stronger self-confidence will arise from applying this knowledge. Your capacity to solve problems will increase. Think about the knowledge you have gained. You'll have the chance to use the skills and information when facing future problems because of your growing awareness and dedication to succeeding. Your ability to concentrate and be more focused will significantly enhance every aspect of your life. Greater decision-making. Regain your faith in yourself and others. This will help in making decisions in the future. If you adhere to the discussed concepts, you will continue to develop and create your character throughout your lifetime. More clarity. Reflection regularly will serve as a compass for tracking your progress. You will be aware of your goals and have made plans for the future. This increased clarity allows you to concentrate and stay focused on your goals. Be aware that life's inevitable changes may require your path to accomplishing your goals to change. The route to realization will still be doable as long as the core is strong and you have faith in yourself. Mastering self-discipline for optimal focus. Self-discipline prevents you from overindulging in chips after deciding to eat healthier cuisine, or it prevents you from spending your entire income on pointless clothing. Self-discipline allows you to remain committed to your goals. You can remain disciplined and in control of your reactions in every situation. Self-discipline is a muscle that becomes stronger the more you use it. Lack of self-discipline may cause low self-esteem. Everyone has a different definition of self-discipline. Some of us may find it easier than others to exercise restraint. Everyone, however, may learn to develop their self-discipline muscles. In this chapter, we shall discuss developing self-discipline. What is self-discipline? Self-discipline is consistently controlling your thoughts, feelings, and behaviors. Your ability to stick to your savings strategies, invest, and pay off debt will determine how well your finances are managed. You'll maintain motivation and have a higher chance of success once you understand how to perfect self-discipline behaviors. Thus, it is closely related to willpower, the capacity to control one's desires and behavior. Self-discipline is more about when you take persistent action in preparation to increase willpower, whereas willpower is how you stay focused on a task. Willpower and self-discipline go hand in hand. Benefits of self-discipline. There are many good reasons to develop discipline in your life. The advantages of developing self-control are numerous, as I've stated here. Reduces anxiety. You are less likely to experience anxiety when you have control over your behavior. You'll be able to do things quickly and efficiently. Therefore, it serves as a strong motivation for developing discipline. Increases your capacity to accomplish long-term goals. Learning to increase self-discipline enables you to accomplish your goals with fewer distractions and self-imposed failures. Additionally, it means reaching them earlier than if you had allowed yourself to become sidetracked. Increases your happiness. You feel better when you are moving toward accomplishing your goals because you are succeeding. Increasing self-discipline is a key factor in this. You get more resilient. Your capacity to withstand temptation grows as you learn how to develop discipline. As a result, you become more resilient as you deal with various situations. You won't be as tempted to give up on your goals or slow down your development. What causes a lack of self-discipline? Lack of motivation and a lack of goals or goals to work for lead to a lack of self-discipline. It might also be connected to your emotional and mental state, particularly your mentality. Your emotions, drive, and willpower may suffer if you focus mostly on the negative. All of those affect your self-discipline. How can I develop my discipline? Being deliberate is key to developing self-discipline. This entails changing your perspective to concentrate on the areas you wish to develop and taking deliberate action. Making it easy for oneself to achieve is also important. Identifying the areas you can automate might also be quite beneficial. Continue reading to learn more. You can break negative habits, achieve both long-term and short-term goals, and entirely transform your life by learning how to develop discipline. Consider it an investment in yourself. Here are 7 self-discipline suggestions to help you live the better life you deserve if you're willing to put forth the effort. 1. Start the countdown, then take action. Count to 10 starting when you're unmotivated, then push through whatever you're doing. A brief countdown can help put you in the proper frame of mind to become motivated. Sometimes all we need is a little prodding to move forward. This is how developing self-discipline starts. 2. Position your goals where you can view them daily. Writing down a goal makes it much more real and is crucial in developing discipline. Put it up somewhere you'll see it always and be motivated by it, such as your car, bedroom, or workstation. Write the goal in your planner. Put it on the calendar in your kitchen. You should be able to find it everywhere. You may even program calendar reminders to sound once a week on your phone. Be kind to yourself, though. Instead of scaring or embarrassing yourself into achieving your goals, be joyful, upbeat, and motivating. Adding self-discipline quotes from role models will help you stay motivated. Spend time reviewing your goals to ensure they align with your desires. 3. Recall your initial motivation. Of all the self-discipline tips offered here, this can help you persevere when facing difficulties. Keep your eventual goal in mind without losing sight of where you started. Always remind yourself why you established this goal and what you will have accomplished once you have completed it, especially when times are difficult. Imagine yourself in complete control of your life, achieving the exact goal you have set. Create phone reminders to tell yourself how far you've gone and how proud you are of yourself. affirmations are a powerful tool for maintaining your why-driven perspective. 4. Prioritize small goals. Try not to set the bar too high when learning how to develop discipline. Setting and attaining a little goal will help you gain confidence before attempting a bigger one. For instance, if your long-term goal is to run 5 miles without stopping, make a quarter mile your starting benchmark. Try not to lose patience with the process and practice patience with yourself. You may find the drive to continue by first achieving those small goals. Starting small will help you develop self-discipline over time. 5. Work on setting priorities. Choose the tasks that need the most effort. Then plan your day to dominate them completely. Creating a study plan makes you less inclined to put off unpleasant tasks. Put tasks you may not enjoy at the top of your priority list, and you'll be glad when they're finished, rather than pushing them off for another time. 6. Recognize your weaknesses. Do something to actively counter your flaws if you want to learn to be more self-disciplined. Determine your potential areas of error and how you might avoid them. For instance, if you have a 5K to race this Saturday, but your friend is holding a barbecue on Friday night, it could be smart to forego it. Alternatively, if you know you need to get to work an hour early, but you tend to stay up late, consider buying some melatonin. You have the means to combat your inner demons. All you have to do is look for them. 7. Ask your friends to help you stay on track. If someone you look up to is observing, you are less inclined to cheat on your goals. Set a goal with your hero or just your best friend. You can encourage one another. And as you learn how to develop discipline, you can be there for each other when the going gets rough to give each other that extra push. 10 tips to boost your willpower. Okay, we know that we have a certain amount of willpower, and as we go about our daily lives, stress and self-discipline decrease our resources. Let's explore our choices for boosting our available pool of willpower. 1. Commend hard work. It can be discouraging if you don't lose weight because it takes a lot of discipline to refrain from eating chips or chocolate with lunch every day of the week. Remember to be proud of your effort because it has improved your willpower. 2. Have faith in yourself. Self-confidence is essential. You're less likely to give up if you have faith that you can complete a 5-mile run and can picture yourself winning a medal and standing on the podium. 3. Specify your goals. Determine your goals and your route to them. Otherwise, it will be like looking for hidden treasure without a map. Making a plan in advance can help you concentrate, and several applications are available to track your progress. 4. Establish a routine. If you're busy, create a schedule to make sure you fit in exercise and prepare nutritious meals and snacks in advance rather than ordering takeout. 5. Increase gradually. Going overboard weakens willpower and positions you for failure. The tortoise and the hare syndrome could be a better name for this. Change your diet gradually and incrementally, then ramp up your exercise routine. 6. Pick the appropriate time. If you're spending a lot of energy studying or moving houses, you might be setting yourself up for failure if you try to quit smoking simultaneously. Willpower is a finite resource. If you've recently moved houses, starting an exercise program or a healthy diet might be a good idea because it can be easier to change behaviors when you're out of your former pattern. 7. Take care of yourself. You will likely have 1 or 2 cigarettes before you successfully stop smoking. So try not to blame yourself excessively and, instead, be gentle to yourself. 8. Reward yourself. Because summer is so far away when you're dining in a restaurant in January, it might be challenging to spur yourself on with thoughts of how fantastic you'll look then. Small, non-calorie rewards can be more effective along the way. 9. Get support. A little encouragement from friends and family or joining a running group might mean the difference between failure and success. Even verbalizing your goals can help them become more evident. 10. Keep out of temptation. The greatest strategy is to avoid it if, like Oscar Wilde, you can fight anything except temptation. If you enjoy sticky buns, stay away from bakeries. If drinking alcohol makes you need cigarettes, avoid going to bars until you've broken the habit. Effective time management strategies for enhanced focus. The key components of efficient time management solutions are prioritizing the most crucial tasks and completing them quickly while keeping a high-quality standard. Hard to say? We've got you covered with tips on how to get there, so don't worry. Additionally, using these skills, you can complete tasks successfully, advance your career, and free up more time. Creating these skills is comparable to beginning a new exercise regimen. Staying motivated, forming new routines, and exercising previously untried muscles could be difficult when you first begin. But, much as with exercise, you'll be happy you persisted when you reflect on your development months later. More will be accomplished as you become more adept at focusing and managing your priorities. Everyone wants to leave work on schedule and feel rested for their personal lives. Although many people associate good time management with their professional life, the advantages extend further into our personal life. I assure you that your work will improve once you have more time for your loved ones, friends, and interests. What is time management? A time management system lets you schedule the time you'd like to devote to a particular task or tasks each day. Time management is all about making the most of each day and finishing it with the satisfaction of knowing you accomplished everything you could in 24 hours. It indicates that you used your time well and completed the tasks you had set out to do for yourself that day. You'll be more effective in accomplishing all your work and life-related tasks and responsibilities if you have solid time management skills. Prioritizing your job tasks according to their importance and urgency, and estimating the time required to finish each activity in advance is the main concept underlying effective time management. Most important time management strategies. A time management strategy is a comprehensive approach to enhancing your time management. You can devise your plan, experiment with various time management methods and add them, hone your specific skills, or try something entirely else. In the end, the decision is all yours. Here are a few of the most well-liked time management techniques that have consistently been shown to work. Create a to-do list. Many of us go through our days working and occasionally wonder if we forgot something. Okay, not any longer. A simple to-do list can ease that pressure. A to-do list should normally contain the tasks you must perform for work and any personal obligations. It's crucial to strike the right balance between your life and work duties. A to-do list is handy here because it makes it easier to observe how much time you spend on each task individually. Make sure to prioritize your tasks as you create your to-do list. Making a list of tasks you can complete fast is easy. But if you do that, you run the risk of not allotting enough time for the day's most crucial tasks. You should write down your daily tasks and frequently update and review your list if you want to use a to-do list as a time management tool successfully. This will help you set priorities and adjust them if anything unforeseen occurs, such as a client who requests a project report earlier than usual. Start with the most challenging task. This time management technique is based on the notion that if you do the most challenging activity first, everything else will seem easy in comparison. It's like jumping into the pool's deep end without first working up to it. The drawback is that this approach might not be effective for everyone, as some people prefer to begin their days with easier tasks to warm up. Even though it may not be for everyone, beginning your workday with high-value tasks has been an efficient time management technique. You only need to try it to see if starting your day with the most difficult tasks will help you better manage your time. Get rid of all distractions. Working while distracted can harm your productivity and capacity to complete your daily activities properly. Therefore, it should go without saying that trying to eliminate all distractions is one of the most crucial time management techniques. To accomplish that effectively, you need to recognize the distractions that interfere with your work and take steps to eliminate or at least lessen their negative effects on productivity. Turn off your phone, for instance, if it is continuously beeping because a new post has been made on any social media platform you use. Try turning off the notifications or delaying checking emails or Slack messages until you have finished your task, if doing so prevents you from finishing your tasks. You can experiment with website and app blockers. These applications prevent you from being distracted while working by blocking some websites or other applications. You decide which ones to block. Maintain a healthier way of life. Taking care of your health is crucial to an effective time management plan. Don't misunderstand us. We're not trying to advise you on how to live your life in any way. It aims to inform you of the significance of controlling and raising your energy levels to improve focus and productivity. According to studies, those who consistently engage in physical activity and consume nutritious diets experience higher energy levels than those who do not. Additionally, having extra energy will allow you to use it more efficiently and stress-free to complete your tasks, projects, and hobbies. Identify and set your priorities. Another fantastic method for managing your time is identifying and ranking your priorities in order of priority. Your everyday productivity can be greatly increased by clearly separating what is vital from what is not. You'll clearly understand what needs to be done and in what order by categorizing your tasks according to their priority. You might even be surprised to learn that some tasks don't need to be finished. That is the influence of prioritization. Examine software. Turn to the machine if everything else fails. The software tries to address practically every problem, regardless of whether it has anything to do with time management. Additionally, some address the issue of effectively managing time, activities, projects, or other factors. Managing distractions and creating an ideal work environment. It's easy to become sidetracked at some point throughout the day, whether working at an office, from home, or in a grocery store. It can be hard to stay focused when working, but you can develop routines that block distractions. Eliminating distractions at work encourages greater productivity for you and other workers and enables you to complete your work more quickly. This section covers strategies for reducing workplace distractions. Make a plan before starting. Consider creating a plan of action before you start your day's work. Before the day is up, list the goals you want to achieve and cross them off as you go. You may allocate a specific amount of time to each task by knowing what you must complete before starting. Place deadlines on your goals. After creating a list of goals you want to accomplish by the end of the day, you can allot a particular amount of time for each item based on how long you anticipate it will take to finish each work. While some tasks, like responding to emails relating to your job, can be finished quickly, others will take far more of your time and effort. The degree of difficulty of each assignment may be directly related to the length of time you give yourself to do it. Finish the most difficult jobs first thing in the morning. Consider starting your workday with the things that require the most effort when making your daily goal list. Before a full day of work, our minds are often alert and clear in the morning. The more difficult task can be finished now, freeing up time for you to finish the smaller ones later in the day, when it could be harder to maintain concentration for extended periods. Establish more compact goals. You can handle work more efficiently by setting small goals for yourself throughout the day. Consider breaking up a larger goal into smaller targets if you think it will take you more than a half day to fulfill it. You can accomplish the bigger goal by setting smaller goals and developing a step-by-step method. As opposed to trying to complete the task all at once, doing this enables you to focus for shorter amounts of time, allowing your mind to take more frequent breaks. Reduce the amount of time you have to work. Deciding when you will begin to work and when you expect to finish for the day before each workday may be helpful. To stay focused while working and complete the task by the deadline you've set for yourself, it helps to know exactly when you intend to end your day. Additionally, it prevents you from working too much and leaves you with more time for leisure activities. Avoid being distracted. Technology is a significant source of interruptions for those trying to finish their task. Consider turning off the incoming notifications on your smartwatch, other devices, and cell phone. Keep any streaming video services for after your work is done, or after you decide to take a break. By removing technology distractions, you can maintain your concentration on your work for longer and finish it earlier. Make yourself comfortable. Distractions may be less frequent when you are relaxed and comfortable while working. The degree of comfort you can get may vary depending on where you work. If you work remotely, you can adjust the temperature to your liking and put on clothes that will make you feel at ease all day. You can bring in objects that make you feel at ease if you work in an office, like an oil diffuser or a lamp with adequate lighting. Sleep. To function well during the day, it is imperative to get enough sleep. Your brain will perform at its peak in the morning if you give it enough time to rest and recharge at night. You can focus on your task more if you do this. Engage in meditation. Meditation helps the mind let go of distracting thoughts so that you can concentrate on one thing at a time. Consider taking a brief break from your task to pay attention to your breathing. Sit quietly and be calm, even breathing in and out, counting to a number of your choice. When counting, try to disregard any thoughts that may come to mind. The first few times may be difficult, But if you can control your thoughts and focus solely on your breathing and counting, you could find that when you're finished, your mind feels clearer and you can concentrate when you return to work. Make use of visual cues. Sometimes all you need to get your mind back on task is a visual reminder. Merely placing a sticky note with the word focus someplace in your workspace can help with this. Whatever image you decide on, make sure it's prominently displayed so you can refer to it often as a prompt to keep on target while you're working. Have a rest. During the workday, many individuals often forget to take brief breaks. They enable you to reduce distractions and enhance the general quality of your job productivity. Think about taking a brief break every hour to give your mind a break from working on your tasks. You can stretch, eat a snack, walk, read a few pages of a book, or listen to music. Setting a timer can help you keep track of your break so that when it goes off, you've finished what you were doing and are ready to return to work. Reward yourself. Delaying gratification can occasionally encourage people to work more quickly. This can be accomplished by selecting a treat to enjoy after achieving your day's main goal. Consider a method that will encourage you to finish your task to take advantage of your reward, whether allowing yourself a 30-minute break to watch TV, placing an order for your favorite lunch, or enabling yourself to use your phone. Set up your work area. To keep things clean and organized for the next day, try clearing your workspace each day by taking out any extra pens, garbage, or anything that can distract you. You might also want to keep some water bottles and a snack nearby to quickly reach for them if you get thirsty or hungry without pausing your work. Disable push notifications. You can receive many email notifications during the day if you work in an office setting. You may wish to disable all of your computer's notifications to prevent you from getting tempted to take work breaks to check your emails. You can check them while taking a break from work or include time in your daily goals for checking and responding to all emails. Recognize when your mind wanders. It's easy for our thoughts to stray from whatever task we concentrate on at work. Being more conscious of when you're deviating from the task you're working on could ultimately save you time by enabling you to regain your focus on what you're currently doing. You can stop thinking about the kinds of thoughts that keep you from working by being aware of them. For instance, you'll be conscious that those thoughts are a main distraction for you and can recenter your focus on what you are currently working on if you notice that you're frequently thinking about what your dog is doing at home while you're away. Developing a growth mindset for improved focus. When you have a growth mindset, you can see beyond your current industry and professional status and realize that you have the power to change it. What you previously believed to be a predetermined potential can be changed via learning and skill development. Adopting this viewpoint gives you many possibilities, raising your personal and professional productivity. In this chapter, we define a growth mindset, compare it with a fixed mindset, and discuss how to use your growth mindset in the workplace. What is a growth mindset? A growth mindset is a mode of thinking that emphasizes improvement and growth over the idea that your unique skills, traits, and personality are set in stone. When you accept a growth mindset, you can work on enhancing your current skills while simultaneously acquiring new ones. This can enable you to succeed while pursuing your MBA and a job, helping you to reach your academic and professional goals. Growth mindset versus fixed mindset. A growth mindset entails continually changing and improving as you develop your skills. This starkly contrasts with a fixed mindset, in which you can believe you cannot acquire any new skills. If you have a fixed mindset, you might also think that you can only make minor adjustments to your skills rather than major ones. You may not be able to succeed in school or at a job if you have a fixed mindset. You'll be better positioned to concentrate on achieving your goals if you adopt a growth mentality. Growth mindset myths. Ensure you understand what a growth mindset entails before adopting or cultivating one. A few growth mindset myths may give you the wrong impression and make it more difficult to adopt this mindset. For instance, it's a common misconception that you must always be optimistic if you want to have a growth mentality. Maintaining a cheerful attitude or an optimistic view might occasionally be beneficial. Being optimistic at all times is impractical and might lead you to live in denial rather than accepting your limitations and putting up the effort to overcome hurdles. The idea that having a growth mindset makes it easy to accomplish your goals is another growth mindset fallacy. Although having a growth mindset is a strong tool, you may still need to put in more effort to attain your goals. Having a growth mentality might help you stay inspired as you go. Overcoming limiting beliefs and embracing a growth mindset. A limiting belief is a thinking or emotional state that prevents you from acting in a certain way because you believe it to be the absolute truth. Additionally, these convictions don't always have to pertain to you. They might deal with concepts, interpersonal dynamics, and the world's workings. Negative thinking can lower team morale and creativity regarding limiting beliefs at work. Imagine you're developing a new method but lack the self-confidence to suggest a more effective fix. There is no doubt that the result won't be innovative. Addressing your team members' limiting beliefs can help them be more creative and engaged if you are a team leader. The inability to think creatively and outside the box can be caused by holding on to these negative beliefs. Nothing stifles team success like reusing previous concepts. Real growth occurs during these risk-taking situations. Thus, each team member must have enough self-confidence to push outside their comfort zones. Promoting positive thinking at work is crucial to enable your staff to perform and be at their best. While being aware of your self-limiting thoughts can help you change them immediately, overcoming them requires time and effort. A few suggestions can help when looking at how to overcome these anxieties at work and teach your team to do the same. Each method can help you overcome limiting beliefs at work, whether you employ one or a mix of the four. Determine and write down your beliefs. Knowing your limiting beliefs is the first step towards overcoming them. These beliefs often appear to you as thoughts rather than words you speak aloud. Writing these thoughts on paper can help you distinguish between truth and fiction and enable you to recognize how false they are. Journaling your thoughts can lessen any tension brought on by the belief. You might also consider whether this thought is pertinent to the upcoming 10 minutes of work. If not, put the sheet of paper with your negative thoughts away and close your journal. Even if this exercise is done alone, you can encourage your team to undertake it every morning. If team members feel comfortable doing so, you can also organize a weekly meeting where they can discuss their limiting beliefs with their coworkers. Team members have a chance to build more trust as a result. To lead by example, ensure the event is fully voluntary and intend to partake in it yourself. Analyze the precision. If simply outlining your thoughts isn't enough, it can be useful to consider if your opinions are based on fact or fiction. You can see your limiting beliefs for what they truly are by digging deeper into them. Take a moment to pause and consider the notion the next time a bad belief pops up. Consider whether it is self-limiting and whether there is any verifiable proof to support your claim. Determine whether the thought results from past experiences or dread of the unknown. If you strive for perfection, it can hinder your productivity and make you want to give up when things aren't going according to plan. Utilizing the feedback of your team members is one approach to combat this. Ask if you're unsure whether your limiting notion is true. By receiving an impartial viewpoint from someone who doesn't share your perspective, you can more easily distinguish between the truth and the stories you tell yourself. Use uplifting statements. One of the most powerful techniques is using positive affirmations to overcome limiting thoughts. You can boost your self-confidence by repeating positive statements to yourself. Use positive affirmations to change negative self-beliefs into positive ones. For instance, if you tell yourself you are not qualified for a promotion, change your perspective by reminding yourself that you work hard and deserve success. By turning any negative thoughts into positive ones, you can defeat them. Saying things aloud to yourself or others might help strengthen the thought, even though numerous ways exist. This method can be applied when negative emotions arise or included in your routine to stop self-limiting thoughts before they start. Reframing one's negative beliefs about oneself includes changing your thinking from, "I'm not good enough to manage this project," to, "I have the skills necessary to succeed at everything I do." Change the phrase, "I don't have enough time to invest in myself," to, "I can reorganize my time to focus on what's most important to me." By changing how you frame difficulties, your mind can be trained to see the benefits rather than the drawbacks in everyday situations. Last but not least, resist limiting beliefs at all cost. Keep in mind that you are not alone. Everyone has limiting beliefs, including business people and individuals you look up to. The key is to keep going despite the limiting thought and not allow it to stop you. One of the most crucial traits of a leader is perseverance, whether it be in dealing with oneself or others. Though it may be easy to feel depressed amid a negative cycle, set limiting beliefs aside. Sometimes all you need to start moving more optimistically is a breath of fresh air. Mind hacks to boost concentration and mental clarity. What would you do if you were born colorblind, yet feel compelled to experience the full spectrum of colors? You implant an antenna into your head. In reality, there is a constant need for biohacking advice. Vagus nerve fibers, which go from the brain to the abdomen and are said by influencers to be the secret to lowering anxiety, controlling the nervous system, and promoting relaxation in the body, have recently caused a #VagusNerve video explosion on TikTok. Some of the more well-known ones show people sleeping on their backs with ice packs strapped to their chests or sticking their mouths into ice water baths. Deep breathing exercises, eye exercises, and massages of the neck and ears also take center stage. Don't worry if you don't want to improve your body through surgery or cold temperatures. Biohacking need not always entail drastic actions. To improve concentration and focus, there are a variety of little hacks and techniques that you can use on your brain. Practicing mindfulness and meditation for enhanced focus. We have quite demanding schedules and often must focus on several things simultaneously. Meditation is a remedy for this disorganization because it teaches the mind to focus entirely on one subject at a time. As a result, our capacity for concentration improves. We can better focus now and stay focused over time due to our meditation practice. According to research, the brain functions of regular meditators improve. People who meditate regularly are less susceptible to interruptions and wandering thoughts than those who don't. If you want to improve your focus, you can pick a meditation technique that appeals to you from the numerous options. Mindfulness. One of the most successful and well-known meditation methods among the numerous that are readily available is the practice of mindfulness. Can you name any task that can be completed flawlessly without your full attention? High degrees of focus are needed for various tasks, including driving, participating in sports or music, reading, and paying attention at work or school. Additionally, focusing on and finishing a single activity rather than trying to juggle numerous at once would likely provide you with more happiness. You can learn to let go of all other thoughts and distractions as you practice keeping your mind fully present and focused on one thing, such as bodily sensations or breathing. Learning that you don't have to pay attention to every little thought that crosses your mind gives you much freedom. Your capacity for concentration naturally improves when you can be mindful at will. Zen Buddhism. In a study, an Italian neuroscientist, Giuseppe Pagnoni, compared the brain activity of 12 long-term Zen meditation practitioners to 12 non-meditators with similar profiles. Pagnoni discovered that the meditators' minds were more steady and more able to focus than the other group. This is not surprising given the strict techniques at the heart of Zen meditation practice. Counting the breath cycles. According to a recent study, deep breathing benefits our bodies by enabling us to manage stress more effectively. Many cutting-edge businesses have meditation spaces, encouraging staff members to take a break, unwind, and concentrate on breathing. Counting the breaths is one meditation technique that is very beneficial for people who struggle with concentration. This type of meditation goes beyond mindfulness by providing the meditator with busy work to complete, such as counting each inhalation and exhalation. Breathe in, breathe out, 1. Breathe in and out, 2. Breathe in, breathe out, 3, and so on. Being present throughout this procedure is a powerful concentration exercise. Many individuals find their minds wandering before they can count to 3. But with time and persistence, youngsters may sharpen their focus and continue counting. The possibilities are endless. What about mindfulness and focus? According to studies on sustained attention, guided meditation practitioners are better than non-meditators at concentrating on a single activity. They perform particularly well when given entirely unexpected tasks, which suggests that regular meditation increases alertness and readiness. Selective attention. The ability to select the most pertinent stimuli for focus is another advantage meditation offers. Consistent practice leads to the ability to reduce the amount of attention paid to irrelevant sensory input, which improves performance on activities requiring selective attention. Executive control attention. This kind of attention inhibits the brain's propensity to actively analyze distracting information, such as thoughts about current or previous events. Frequent mindfulness practitioners have been reported to perform exceptionally well in executive control attention compared to non-meditators. Guided meditation for concentration. Guided meditation for focus might be a useful option for you if you find meditation difficult. Here, a meditation instructor's voice will lead you through your practice. The session can occur at your house or a gathering of people. Although it may seem easier to use guided meditation than to do it alone, keeping an open mind is crucial because the mere comfort of being led and instructed can enable the mind to wander or even make you sleep off. As a meditator, you must recognize this and return to the exercise. Most any time is a good time to practice concentration meditation. You can learn to be present and watch your thoughts as they come and go. Think about going about your daily business carefully. For instance, when you eat, try to feel the flavor and texture of your food as you chew, and take note of the many sensations in your body. There is a ton of activity going on there. The entire mouth is involved. The salivary glands are engaged. Numerous muscles are used for chewing and swallowing, etc. Never take any other action. No reading the news, making a grocery list, checking email, or listening to the radio. Simply eat and be aware that you are doing so. You can improve your concentration by concentrating solely on the task while eating or doing other activities. Utilizing visualization techniques to sharpen mental clarity. Visualization is a great tool that enables people to picture their desired outcomes in their minds. We can strengthen our capacity to realize our ambitions and objectives by utilizing the power of imagination. This section examines several visualization methods and offers examples from actual situations to show how visualization may be successful. Including visualization in your daily routine can greatly impact your ability to make your ambitions come true, whether you're working toward personal development, professional success, or better health. Make a strong mental image. Create a clear mental picture of the outcome you want to achieve to utilize visualization's power fully. Visualize every aspect, including the noises, sights, and feelings accompanying achieving it. Your visualization's effect on your subconscious mind will be more powerful the more specific and realistic it is. Example from real life. Sarah, an aspiring athlete, pictured herself winning the race and crossing the finish line first. She visualized the audience clapping, the feeling of her muscles tensing up, and her sense of triumph. She employed this visualization strategy to keep motivated and concentrated during her training sessions, which ultimately helped her win the marathon. Practice visualization meditation. Spending full time visualizing your goals is part of visualization meditation. Find a calm and comfortable place. Close your eyes and focus on picturing yourself obtaining the desired result. Embrace the experience with all of your senses engaged. Example from real life. John, a businessman, employed visualization meditation to see his firm's success. He would invest time daily to envision his business growing, seeing contented clients, and experiencing a sense of fulfillment. This routine helped him maintain motivation, make wise choices, and turn his idea into a lucrative business. Create a vision board. Your goals and desires are represented visually on a vision board. Make a collage that graphically depicts your vision by gathering pictures, sayings, and symbols that reflect your goals. Put the vision board in a visible spot where you can view it daily. Example from real life. Emma, a writer, made a vision board with pictures of best-selling books, popular authors, and literary triumphs. It was hanging in her writing area, and every time she saw it, it inspired her and the drive she needed to keep working toward her writing goals. She eventually fulfilled her goal of becoming a published author. Engage in positive self-talk. Positive self-talk is a strategy that works with visualization by reinforcing constructive thoughts and affirmations about your goals. Use uplifting and empowering remarks to increase your confidence and solidify your trust in your capability to bring about the outcomes you seek. Example from real life. Alex, a student preparing for a difficult exam, used encouraging self-talk. By mixing positive self-talk with visualization, he could lessen nervousness and perform remarkably well in his tests. He would repeat phrases like, "I am prepared and confident," "I will excel in this exam," and "I have the knowledge and skills needed to succeed." Visualize overcoming obstacles. It's crucial to picture yourself succeeding and getting through setbacks and difficulties. Imagine yourself navigating challenges with confidence and coming up with answers. This routine helps you mentally prepare for failures and motivates you when things get difficult. Real-world illustration. Project manager Emily pictured herself effectively guiding her team through a difficult project. She pictured herself resolving disputes amicably, creating creative fixes, and finishing the project with excellent outcomes. She used this visualization approach to be optimistic and push through challenges. Be inspired to act. Although it is a powerful tool, visualization must be combined with action. Apply the knowledge and inspiration you get from your visions to take creative action toward your goals. When you use visualization to find opportunities and take the necessary actions to actualize your goals, it acts as a catalyst for action. Real-world illustration. Michael, a budding musician, saw himself playing in front of a sizable crowd on stage. This goal motivated him to take action, which he did by routinely practicing, connecting with business leaders, and embracing performance opportunities. His images drove his tenacity and helped him achieve important musical accomplishments. Your ability to attain your goals and realize your aspirations can change when you learn to harness the power of visualization. You can synchronize your subconscious mind with your desires by conjuring up vivid mental pictures, indulging in visualization meditation, using vision boards, employing positive self-talk, envisioning overcoming obstacles, and taking inspired action. The real-world examples presented in this section show how powerful visualization is in various spheres of life. Accept the power of visualization and watch your dreams and ambitions materialize. To manifest your dreams, remember that the most important things are to trust in yourself and continuously use visualization techniques. Overcoming procrastination and building productive habits. You're after your workday and looking at your earlier made to-do list. The last project on your list is one you've been putting off. You still haven't finished it. It's already past midnight. You promise yourself that you'll work on the problem tomorrow. You grow more and more angry with yourself for procrastinating. If you identify with this, you are not alone. Almost everyone delays doing something occasionally. Many people don't feel the problem affects their quality of life. However, if you frequently put off doing something and then regret it, you may be in a vicious loop. It's easy to be hard on yourself when you put off tasks at home or work. But is self-criticism warranted, or can your procrastination be a sign of something more serious? It's critical to realize that you are not to blame for procrastination. We engage in this behavior for various reasons, and there are ways we can address it. Identifying the root causes of procrastination. Stress and anxiety are the same things that procrastination causes. Tasks overwhelm us at the time, so we avoid them. Momentarily, this feels fantastic because we get to do what we want and don't have to take care of any obligations. Here are a few more justifications for putting things off. Confidence issues. Imposter syndrome, or the belief that you lack the necessary skills for your position or are less valued than your colleagues, can make you avoid jobs that you know you are capable of doing. Imposter syndrome and other confidence problems, like self-criticism, are exacerbated by low self-esteem. Check to see if you have unattainable goals for yourself, or just need reassurance from a close friend. Perfectionism. While striving for perfection might boost productivity, it can also completely derail a project. Sometimes it's preferable to turn in good work early rather than great work late. Fear of failure. You could refrain from performing some tasks out of concern for your ability to succeed. Perfectionism or self-confidence problems may be the cause of this. Fear of failure can also result from a bad work environment. Think about whether your place of employment encourages constructive criticism and a healthy work-life balance, or if you have to cope with toxic productivity and unhelpful criticism. Lack of motivation. You are less likely to finish a project if you lack inspiration. Low motivation results from various causes, including burnout or a dull routine work environment. Re-examine your goals to identify effective motivators and, if necessary, make lifestyle adjustments. Mental health disorders. Procrastination and psychological well-being are inextricably tied to conditions of the mind. ADHD, anxiety, and depression patients are more likely to shy away from demanding tasks. If you believe that a more serious medical condition brings on your procrastination, you might want to talk to a mental health expert. Strategies to overcome procrastination and boost motivation. A deadline is approaching for you. However, you occupy your time with unrelated activities instead of working, such as reading emails, using social media, watching movies, browsing blogs, and participating in forums. You should be working, but you're not in the mood despite knowing it. The phenomenon of procrastination is well known to us all. We waste our spare time when we put off accomplishing crucial tasks that need to be done now until it is too late. And when it is too late, we freak out and regret not starting sooner. My acquaintances who consistently put things off have been caught in this cycle for years. Delaying, postponing, slacking, avoiding work, only facing work when unavoidable, and then continuing this cycle. It's a destructive habit that saps our energy and keeps us from achieving more. Avoid letting procrastination rule your life. Here, I'll outline my strategies to avoid putting things off. Organize your work into manageable steps. We postpone because we unconsciously feel the task is too difficult to handle. Divide it into manageable pieces, then concentrate on each component separately. After breaking the task down, if you find that you are still putting it off, break it down further. Your task will become so easy in time that you'll say, "Gee, I might as well just do this now." For instance, I'm currently working on a new book about how to succeed in life. Writing a book is a huge undertaking that can be overwhelming when taken seriously. However, when I divide it into stages like research, selecting a theme, drafting the content, writing chapters 1 through 10, revision, etc., it suddenly appears to be fairly manageable. Then, instead of concentrating on the subsequent phases, I concentrate on the current one and complete it to the best of my ability. I move on to the next one after it is finished. To deal with at least 2 of the 3 elements contributing to procrastination, risk aversion and rewards lists are highly helpful if you can't stop doing it. Change your environment. Our productivity is impacted differently by various situations. Take a look around your workstation and room. Do they encourage you to pursue your goals or make you want to cuddle up and rest? If the latter, you ought to think about switching up your workstation. One thing to remember is that a setting that once inspired us may eventually lose its power. It's time to rearrange things if that's the case. For instance, if continual movement and noise prevent you from working in public spaces, look for a quiet area to sit down and concentrate. Try to eliminate any sources of distraction from your workspace, both physical and digital, to stay on task and avoid procrastinating. You could take your iPhone, set it to Do Not Disturb, and then stow it somewhere in a drawer where you'd have to check it. Also, turn off the alarms and notifications on all of your devices. In essence, unplug before you plug in and pay attention. Make a comprehensive schedule with deadlines. One deadline for all of your tasks is a procrastination invitation. That happens because we think we have time and keep delaying things until it is too late. Your project should be broken down, see tip 1, after which you should make a broad schedule with deadlines for each minor activity. In this manner, you know that each task has a due date. Your deadlines must be realistic. For example, if you don't do this by today, everything you have planned for tomorrow could be in jeopardy. This makes it urgent to take action. My goals are divided into monthly, weekly, and even daily task lists. Each list is a call to action that I must follow by the deadline to keep moving toward my goals. Get rid of your procrastination roadblocks. If you find yourself delaying things a lot, it can be because you make it easy to put things off. Select the browser bookmarks that consume the most of your time and move them to a less accessible, different folder. In your email client, disable the automatic notification setting. Get rid of any outside distractions. Some people will deactivate or delete their Facebook accounts to clear the way. Although I believe it's a bit harsh and drastic, go for it if you feel that's what's required. Addressing procrastination is more about becoming aware of our activities than reversing them with self-binding techniques. Limit the number of choices you must make. Every choice we make has an energy ramification. If you ask yourself, what do I need to do today? When you wake up in the morning, well, you're about to put off something today. You'll waste a lot of time worrying about what to do and what not to do if you start each new day without having thought through the outcome you want it to have. Should I work out today or wait until tomorrow? Should I accept Barry Boombatz's invitation to lunch with accounting? Or should I have a quick lunch alone to return to the office and complete this presentation? Which should I wear, this or that? Should I eat this or that? When should you respond? All day long, we ask ourselves questions similar to this. We are forced to reply to questions with responses, which force us to reach decisions. You become exhausted and lose all self-control, which causes you to put off doing the things most important to you. Making decisions in advance and developing routines in specific areas of your life can help you be more effective and prevent you from using up energy considering whether to do something. This will help you reduce the number of daily decisions you must make. These are merely a few simple instances, but the little things usually count. What concrete ways can you come up with to make fewer decisions in your life? Doing this frees up the focus you need to do the important tasks without putting them off by working on the less important ones. Complete your day before it begins. This advice continues where tip 1 ends. Planning your days ahead of time is the best decision you can make to avoid procrastinating. It would be wiser to take a few minutes at the end of each day to quickly plan the following day rather than scrambling to figure out what you'll do on any given day. For instance, each night before I go to sleep, I jot down or review my goals for the following day, which include my one big thing, or OBT, for the day to complete. This might be a significant undertaking, a goal, or a project I need to move on with. My no matter what's, or NMWs, are my daily routines that cannot be changed. Working out, going for a daily nature walk and meditation, reading for at least 30 minutes, doing work connected to mastery, and spending time with the people I love. Complete any remaining tasks the next day. In this way, I can give my most critical goals and projects plenty of time to be completed and avoid procrastinating. Restate your goals. If you have been putting things off for a while, there may be a disconnect between what you want and what you are doing right now. As we learn more about ourselves, we often outgrow our goals, but don't adjust them to reflect this. Get away from your job. A quick trip is preferable, but a weekend getaway or staycation could also work. And take some time to rest and recover. What precisely do you hope to accomplish? How are you supposed to get there? What actions should you take? Does your current work fit that description? What can you do if it doesn't? Stop making things too complicated. Are you awaiting the ideal moment to carry this out? Perhaps X, Y, and Z make this the worst possible time to act. That thought should be abandoned because the ideal moment never comes. You will never get anything done if you keep waiting for one. One of the main causes of procrastination is perfectionism. Reward yourself. Some claim that rewards don't provide effective motivation. Never trust them. They're most likely criminals. Okay, maybe not, but they're only correct regarding external benefits, sometimes known as bribes. In reality, giving staff rewards doesn't always motivate them more. However, rewarding yourself is just common sense, so do it. You need that bing moment because you're just a big hairless ape with a laptop and a penchant for fine coffee. If you simply can't stop putting things off, use this workaround. Researchers put monkeys in a cage with a button that, when pressed, released a piece of food from the cage. When the monkey pushed the button, it exclaimed, "Yum!" So he gave it another push, again and again. Of course, monkeys are simply little hairy people without laptops or coffee, so they pick things up rather quickly. Then the researchers inserted a catch. The monkey would receive an electric shock every third time he pushed the button. The monkey exclaimed, "Ouch!" before eating his treat. The next time he said, "Ouch, ouch!" before eating his treat. The story's moral is that we put up with a lot of nonsense as long as we get our reward. Your task is to select a treatment that is satisfying enough to press the button, even if you know it will hurt a lot. Take some time off. If you struggle to overcome procrastination, try not to be too hard on yourself. Keep in mind that humans enjoy stewing in their unfinished mess of work from time to time. Just put in a lot of effort to escape. In reality, taking a break increases productivity. Take a break when you're worn out or lacking in motivation. You won't try to procrastinate as hard in the future if you are not so hard on yourself about when a task is due. Simply reschedule and resume your plan later or tomorrow. Moreover, we are connected to the digital world. We have music or sound playing all the time. It can be debilitating and stressful, making us lose interest in our jobs and daily activities. Even a 5-minute break can prevent weariness and keep your thinking alert. I advise you to utilize the Pomodoro timer. It is an excellent tool to use in scheduling breaks. Start the timer for 25 minutes, then do what it says. Spend time with those who motivate you to act. Spending only 10 minutes conversing with Steve Jobs or Bill Gates will encourage you to take action more than if you choose to do nothing. Our actions are influenced by the individuals we are with. Of course, spending time with Bill Gates or Steve Jobs every day is probably not a realistic approach, but the idea still holds. Everyone has hidden power around you. Find friends or coworkers who make you feel triggered. They are probably hard workers and go-getters, and spend more time with them. You'll soon instill their enthusiasm and desire as well. I hang out with motivational personal development professionals by reading their blogs and communicating with them frequently via email and social media as a personal development writer. It's new media communication, and it works the same. Find a motivational partner. The entire process is considerably more enjoyable when you have a friend around. Your friend should ideally have a different set of objectives. You'll keep each other responsible for sticking to your plans and goals. Although you do not require both to share the same goals, it will be even better if you do, so that you can benefit from one another. I regularly speak with a wonderful friend, discussing our goals and steps. It motivates us to keep acting. Communicate your goals to others. This accomplishes the same thing as number 6, but on a bigger scale. Inform your family members, friends, and acquaintances about your projects. They will inevitably ask you about your progress on those initiatives anytime you encounter them. For instance, occasionally, I provide updates about my initiatives on Twitter and Facebook, and readers often ask me about them. Holding myself responsible for sticking to my plans is a terrific approach. Find a person who has already attained the result. What do you hope to achieve here? And who are the people who have already succeeded in this? Find them and make contact with them. One of the biggest motivators to take action is witnessing firsthand how easily your goals may be attained if you take action. Creating an environment conducive to productive habits. A workplace environment includes people, the physical setting, the culture of the company, and working circumstances, all of which can influence an employee's daily job satisfaction and productivity. Therefore, fostering a positive workplace culture is crucial for increasing employee motivation, productivity, job satisfaction, and general well-being. Ultimately, these responses may produce superior outcomes for the organization's profitability and scalability. Several suggestions for fostering a positive work atmosphere are covered in this section. What is a conducive work environment? It is a setting that promotes worker productivity. Physical comfort, open and honest communication, appreciation of individual contributions, and healthy relationships among coworkers are all components of a comfortable workplace. Employees feel at ease, inspired, and engaged since they have the necessary tools, cooperation, and support to achieve. Furthermore, there is a clear culture of inclusion, equity, and diversity among coworkers. Why is it important to have a conducive workplace? By encouraging a sense of community and connection among employees, a happy work environment can boost collaboration, teamwork, and the quality of the products produced by joint ventures, thus increasing customer satisfaction. This may benefit workers' morale at work, satisfaction with their jobs, productivity, well-being, and ultimately the success of the business as a whole. Is optimum performance dependent on a favorable work environment? Yes. Employees often function at their best when their office space and working environment are accommodating enough. When a company supports a positive culture of diversity, equality, and inclusion to foster collaboration, respect, and teamwork, they also tend to have a more excellent working morale and engagement level. You can count on your employees to give their best work and stay with the company when they feel recognized, cared for, and valued. What typical problems can prevent the creation of a favorable work environment? A company with contradictory policies, weak leadership, poor communication, and inadequate transparency may have a less favorable work environment. Lack of diversity in the workplace culture can also result in discrimination and harassment, as well as a hostile work environment where employees don't feel valued or safe. Inadequate tools and resources for the job, few possibilities for professional advancement, and a physical workspace that isn't well designed and maintained can also impact employee productivity and well-being. Employee resistance to change and a lack of safety, information, value, or inclusion in decision-making can result in disengagement, low productivity, and low profitability for the company. How can I encourage a positive work atmosphere while recognizing and rewarding individual contributions? Employee motivation and engagement must be maintained in the workplace by recognizing and rewarding individual contributions. Giving consistent, accurate, and timely feedback on a person's performance and contributions is one method to do this. Another strategy is to reward great work through incentives, bonuses, or other rewards. 10 tips on how to make a conducive workplace. Increased job satisfaction, less stress, and greater staff morale can all result from an ideal workplace setting. Here are some suggestions for establishing a positive work environment. 1. Encourage a culture of inclusion, equity, and diversity. Starting with leadership that exemplifies inclusive behavior, offering training and tools, putting policies and practices into place, and actively responding to employee input that encourages diversity and prevents discrimination are all important steps in fostering a positive workplace culture. A workplace culture that promotes equity, diversity, and inclusion can undoubtedly impact how employees treat one another daily, the behaviors we reward, who we promote, and the areas in which we invest. Additionally, it promotes expansion, worker retention, and long-term financial stability. 2. Support open communication. A productive workplace is built on open communication between management and workers. Regular team meetings, an open door policy, and chances for employees to provide feedback all contribute to developing trust and a sense of teamwork among workers. 3. Encourage work-life balance. A good workplace can only be achieved by striking a healthy work-life balance. Offer flexible working hours, allow for telecommuting, and encourage employees to take regular daily breaks to help them maintain a healthy work-life balance. Employees are more likely to be inspired and engaged if they believe their work-life balance is respected. 4. Fair compensation. Another strategy for fostering a positive work environment is providing appropriate incentives and remuneration. Every employee aspires to work in a setting where they are valued for their contribution to the company. Employee motivation and engagement will rise when fair compensation is provided, such as raises, bonuses, promotions, and other types of recognition. 5. Give chances for development and growth. Training and career growth are two things that many individuals are often seeking when applying to firms. Employees should be able to take on demanding responsibilities and projects to grow professionally. Regular chances for training and professional development, such as workshops, seminars, and career mentorship programs, can also foster growth and development. 6. Create a relaxing workspace. Designing and maintaining a physical space that is welcoming, practical, and aesthetically appealing for employees is part of creating an ambient workplace. The absence of distractions and the encouragement of intense concentration foster optimal working conditions. Ergonomic office furniture, proper lighting, the control of outside noise, and natural components like plants are some elements that contribute to a comfortable work environment. A more comfortable workplace might also benefit from breaks and quiet areas for concentration. 7. Clearly define the job expectations. When their job expectations, obligations, and duties are clearly stated, employees perform better and are more productive. Employees perform better when they are aware of the requirements of their tasks and when managers give clear instructions. This will enable them to receive accurate performance feedback and prevent overwork, stress, and burnout. 8. Make dependable tools and equipment for the job accessible. The availability of high-quality tools and equipment is essential for fostering a positive work environment by empowering employees to do their responsibilities quickly and accurately. This involves giving the tools, software, and hardware needed to do their jobs and ensuring everything is maintained, current, and easily available. Make any necessary adjustments after routinely reviewing employee input on the tools and equipment's usability and quality. 9. Improve your hiring procedure to remove negative energy. Employing people who do not match your company's beliefs, objectives, community, or clientele can create a negative work atmosphere that is unfriendly to other employees. Your team should be grounded in a business culture emphasizing appreciation, excellence, and dedication to going above and beyond for your clients, the candidates you place, and other team members. Since your company's culture and goals are important, you should expedite the hiring process to find candidates with the abilities, morals, and attitudes you seek. Along with having these skills, a person should be able to work well with others, communicate well, and respect others. You should fire an employee immediately if they're causing havoc or interfering with business operations. This is because they may spark a riot or dispute among coworkers. Inquire employees about what makes them happy and what could improve the workplace environment simultaneously. 10. Fostering a strong sense of teamwork. A positive work environment is often created by a workplace that stimulates collaboration and encourages employees to form relationships with one another. In the end, a strong sense of teamwork can increase engagement, job satisfaction, and productivity. It can also be accomplished through planning team-building activities, hosting social gatherings, and promoting collaborative initiatives. Strategies for combating burnout and recharging your focus. A unique form of work-related stress called job burnout is a state of physical or emotional tiredness that also includes a sense of diminished accomplishment and a loss of one's sense of self. Burnout is not a recognized medical term. Some specialists believe that depression or other disorders may be to blame for burnout. Researchers have noted that a person's personality and family circumstances can affect whether they experience job burnout. Job burnout can impact your physical and mental well-being, regardless of the source. Think about how to recognize job burnout and what you can do to prevent it. What is burnout? Burnout is a response to ongoing or persistent workplace stress. Its three primary defining characteristics are exhaustion, cynicism, less connection with the job, and perceptions of reduced professional abilities. Simply put, you show signs of burnout if you feel worn out, dislike your job, and feel less competent. People spend most of their waking hours at work. Therefore, it could significantly impact you if you hate your job, dread going to work, and don't feel fulfilled by what you're doing. This toll shows up via burnout symptoms. Recognizing the signs and symptoms of burnout. Although burnout is not a psychological condition that can be diagnosed, that doesn't mean it shouldn't be handled seriously. You can experience both physical and mental signs of burnout. Physical signs of burnout. The body often manifests symptoms of burnout. Research shows typical physical burnout symptoms include gastrointestinal disorders, high blood pressure, weakened immune system, often getting sick, recurrent headaches, sleep problems, etc. Chronic stress is a major contributor to burnout, so it's important to understand how it impacts the body. Physical symptoms of chronic stress include greater aches and pains, low energy, and changes in appetite. These physical symptoms could all be markers of burnout. Mental signs of burnout. You are also affected intellectually and emotionally by burnout. The most typical mental signs of burnout include difficulty concentrating, depression, a sense of worthlessness, lack of interest or pleasure, suicidal thoughts, etc. Depression versus burnout. Some mental health problems, such as depression and burnout, have similar signs and symptoms. Along with thoughts of suicide, other depression symptoms include a loss of interest in things, a sense of helplessness, and cognitive and physical problems. How can you distinguish between depression and burnout? People who are depressed have terrible emotions and thoughts about every part of life, not simply their jobs. If you feel this way, a mental health professional can assist. People who experience burnout may be more likely to experience depression. Therefore, getting help is crucial. Risk factors for burnout symptoms. Burnout is not a constant effect of high-stress work environments. If your stress is adequately managed, you might avoid these detrimental effects. However, some individuals, and those in specific occupations, are more susceptible than others to experiencing burnout symptoms. Employee burnout can be caused by 5 job characteristics, according to a 2018 Gallup report. Excessive time constraints. Employees who report having sufficient time to complete their work are 70% less likely to suffer from high burnout. But those who cannot get more time, such as paramedics and firefighters, are more susceptible to burnout. Lack of managerial support and communication. The manager's support provides a psychological shield against stress. Employees are 70% less likely to repeatedly experience signs of burnout if they feel warmly supported by their manager. Unclear definition of roles. Only 60% of employees know their expectations. Workers may become worn out just trying to know what to do when expectations are like moving targets. An overwhelming workload. Even the most optimistic staff will experience pessimism when the workload seems insurmountable. Excessive emotions could easily cause burnout symptoms. Unjust treatment. Workers who feel they are being treated unfairly at work are 2 to 3 times more likely to experience high burnout than other workers. Favoritism, unequal remuneration, and coworker mistreatment are a few instances of unjust treatment. The stress that causes burnout can predominantly come from your job, even while pressures from other elements of your life may also cause these levels to rise. For instance, the cognitive patterns and personality traits of pessimism and perfectionism might stress people more. Effects of untreated burnout symptoms. Untreated burnout symptoms may result in the following: alienation from activities associated with employment. People who are burnt out find their occupations to be more and more annoying and demanding. You risk becoming pessimistic about your workplace and your coworkers. Additionally, you could start emotionally distancing yourself from your work and feeling numb. Emotional weariness. Untreated burnout symptoms might eventually leave you feeling emotionally spent and unable to function. Decrease in performance. Burnout impacts regular tasks at work or home if taking care of family members is your primary responsibility. People experiencing burnout symptoms are generally uncreative, have trouble focusing, and feel negative about their tasks. Together, these factors lead to diminished performance. Tips for preventing burnout. Burnout is a phenomenon that, in the words of the World Health Organization, is characterized by reduced professional efficacy, increasing mental distance from one's job, feelings of pessimism or cynicism about one's employment, and energy depletion or tiredness. This condition greatly impacts millennials. 42% of millennials reported feeling burned out at work as of February 2021. Burnout is a phenomenon that can have a detrimental effect on workers and organizations across all industries, regardless of age. Here are strategies for preventing burnout at work, per professional sources, to help you combat times of stress, lack of motivation, or exhaustion. Work out. Exercise is an excellent approach to reducing depression and anxiety, which often coexist with burnout. Regular exercise can enhance wellness by releasing happy hormones and other organic brain substances. Exercise can also help your mind avoid stressful and negative thought patterns. Additionally, exercise is said to increase confidence. These are all preventative measures against burnout. Pro tip: don't overdo it with your exercise because you can overdo it and end up injured and exhausted. According to the CDC, adults can maintain their health with 30 minutes of activity daily. Eat meals and foods that are healthy. People should concentrate on the following 4 key aspects of burnout: mood, immunity, focus, and sleep. Nutrient-rich foods can support the maintenance of such regions. Because they include magnesium, which lowers anxiety, good fats for hormones, and folate for neurons, avocados, for instance, are an excellent mood enhancer. Due to their vitamin K content, which supports immunological and inflammatory responses, Grapes are a fantastic source of immunity support. We recommend olives and olive oil to improve focus because they include good lipids for memory and brain function and vitamin E to protect brain cells. Tart cherries offer melatonin and potassium to improve sleep quality. Pro tip: before incorporating new foods into your diet, always speak with your doctor and be aware of any food sensitivities you may have. Plan and get ready. You can begin to take action to prevent burnout or to preserve a work-life balance once you acknowledge that it is a real possibility in your professional life. These actions include scheduling regular time off from work, taking vacations, or practicing stress-relieving exercises like meditation. Knowing when to acknowledge such sensations is the greatest way to recover from burnout. Take precautions afterward. It is impossible to avoid burnout at work, especially if you are devoted to your work and invest a lot of time and energy. Why not prepare for it then? To avoid burnout, plan to take time off work and engage in activities that will refresh you. Pro tip: if possible, schedule days where you won't be available for meetings as quiet or focus days. By doing this, you can use such days to complete more work before you burn out or to complete less demanding jobs. The Pomodoro technique can help you remember to take breaks. With the Pomodoro technique, you may increase productivity by working 25 minutes at a time with a 5-minute rest. You can give yourself a longer 20 to 30-minute break after 4 intervals. The technique's premise is that you'll be more productive if you take frequent, brief breaks and one longer break each day. The Pomodoro technique can be useful to prevent immediate work stress or symptoms of burnout. Pro tip: you can change the intervals and break durations to suit your requirements and workload better. Keep your eyes safe. People also try to avoid eye strain, which can worsen feelings of weariness, by taking breaks to play with their dogs outside. Check the lighting in your workspace and take steps to minimize glare. This can entail utilizing an adjustable desk lamp instead of all or some overhead lights. You can lower the brightness on your computer or cover the screen with an anti-glare material. Practice meditation and yoga. Yoga allows you to exercise while preparing your mind for analysis and releasing endorphins. After a stressful day, practicing yoga and meditation can help you unwind. According to research, 60% of people who meditate report that it increases their energy, and 50% say it helps their memory and focus. Additionally, the advantages of yoga and meditation can help prevent or manage burnout. Pro tip: to start your day with mental clarity, do yoga or meditation in the morning before you begin your duties. After work, you can also decompress by practicing yoga or meditation. Take a break when you require it. If you are worried about falling behind, taking time off might be challenging. But taking time off is essential to unwinding, clearing your head, and achieving a healthy work-life balance. Pro tip: having regularly scheduled vacations and days off might make you feel more motivated at work by giving you something to look forward to. Be prepared. It can be challenging and stressful to keep track of tasks, deadlines, meetings, and other duties related to your employment. This stress can result in burnout. Make time to manage your life and create a routine. Make a list of your to-dos, placing the highest priority items at the top and the lowest priority items at the bottom. You can also spend money on calendars, alarm clocks, and planners to stay on schedule. Pro tip: some programs offer fantastic digital tools to coordinate tasks and monitor your project's development. Rely on your network of allies. You might be tempted to isolate yourself from others and cope with your troubles on your own while you're coping with burnout. However, socializing with loved ones can help you feel renewed. Even talking to a close friend about a difficult day at work can provide you with new insight for the following day. Check your benefits to determine whether there is anything regarding free or heavily subsidized therapy. You can better understand your stress, spot obstacles, and deal with stress by talking to a therapist. Have a restful night's sleep. According to the CDC, adults aged 18 to 60 need a minimum of 7 hours of sleep per night. But according to research, 35.2% of American adults report sleeping less than 7 hours on average each night. Sleep promotes emotional control, which makes it easier to control or let go of stress. Maintaining a regular sleep routine that leaves you rested and prepared to face the day is a wonderful method to prevent burnout. Create a nighttime routine that helps in winding down and getting your body and mind ready for bed. To get ready for bed, shower warm, sip hot tea without caffeine, and put your phone away. Burnout may be inevitable depending on your industry, but it doesn't have to be a dire circumstance that adversely affects your work and personal life. You can prevent burnout or discover a good management method by taking the actions above. Conclusion. You can't acquire the ability to focus and concentrate better overnight. Professional athletes like sprinters, golfers, and gymnasts practice for a long period and typically have a coach, so they can focus and make the perfect move at the right time to excel. Understanding how concentration influences your life is the first step to improving it. Suppose you have trouble keeping commitments, getting distracted by unimportant things, or not progressing toward your goals. In that case, it's time to get help with concentration so that you can concentrate on what matters most to you. Success in your profession and life depends on your ability to focus at work. You'll discover that you can do more things you value by strengthening your focus while feeling better about yourself. Making time for joy and happiness is as important as completing tasks for a fulfilling life. While some techniques for doing so might be effective, others might not seem to impact you much. Try various strategies to know what works best. The advantages of specific techniques, including brain training, are still debated among experts. However, the current research indicates that many people can benefit from most of these suggestions, at least modestly. Additionally, these suggestions shouldn't have any bad impacts because they are unlikely to impair focus or result in undesirable consequences. Just be careful to consult your doctor if the focus is extremely difficult. It's crucial to rule out catastrophic conditions, such as brain traumas, because there might be an underlying cause.
We appreciate you tuning in to one of our captivating audiobooks. For more immersive experiences, here is another audiobook we're certain you'll enjoy. Don't forget to show your support by liking this video, sharing what you loved about this audiobook in the comments section below, and subscribing for more captivating audiobooks like this. Thanks for being a part of our audiobook community.